Very good morning, everyone. I am Kamal Narayan, CEO of the Integrated Health and Wellbeing Council, India's premier institution for health advocacy, awareness, and behavior change. And on behalf of ISW Council, I extend a very warm welcome to all the esteemed dignitaries, speakers, guests, and viewers of the 6th India Health and Wellness Summit. Standing in the last month of 2020, looking back at the year will leave most of us with not so happy memories. Very few among us are lucky not to lose a family, a relative, a friend, or an acquaintance to the contagion that has infected 760 million people all over the world and has impacted the entire humanity. However, the one thing that this human crisis has brought our focus back on is the need of healthy life and a healthcare system that is resilient, prepared, and proactive enough to protect us, our health, from many such outbreaks. COVID 19 has made us realize the value of segregating the idea of health from curative practices and adopt a more integrated approach where the simplest constituents like good air to breathe in, good food for nutrition that help build immunity, and hygiene that works as the most affordable way to protect oneself from diseases, playing the most significant role in our health and well being, and are recognized and sustained. And this is what ISW Council has been advocating for years now: good air, good food, good water, and good healthcare for all. The findings of the recently released fifth National Family Health Survey 2019 and 2020 emphasize the need for this integrated approach all the more. While child nutrition continues to show a stark paradox in our country, the survey has recorded more than half of women and children being anemic in 13 out of 22 participating states and union territories. Prevalence of anemia among pregnant women too has increased in half of these states and UTs compared to the previous survey. While our burden of non-communicable diseases is growing with over 60 lakh people losing lives in India due to heart failure, cancer, stroke, and diabetes every year, the ongoing pandemic too have infected millions and have killed nearly 1.5 lakh people among us. Amid all this, India has shown an unprecedented resolve for moving towards universal health coverage and has made a formidable stride in the last 2 years in form of Ayushman Bharat, which not only helped millions of poor patients in receiving critical health care for existing diseases, but also came to their rescue against COVID 19. While this strongly revives the dream of ensuring equitable healthcare for everyone, everywhere, turning into a reality will certainly be an arduous trek. And more demanding and challenging can be the journey towards making a society where more than sick care and disease management, we focus on preventing ailments and keeping healthy people healthy. And to realize this goal, it is important that we readjust our focus on fundamentals of life and good health. That is, good air, good food, water, healthcare, as we embark on a journey to become a fit, swasth, and Ayushman India. The sixth edition of ISW Summit is an attempt to chart that way forward for India with pivotal discussions on advancing India's healthcare journey in the aftermath of COVID 19. So, before I introduce our very special guests for this inaugural session, let's have a quick look on the journey of India Health and Wellness Summit over the last 5 years.
The fastest growing nation on the earth faces the fastest growing health challenges, with over 1.3 billion lives at stake. In wake of the swelling disease burden on the stretched healthcare infrastructure and severely compromised health of the nation, it was imperative that everyone gets talking about good health. With the objective of triggering continuous discourse on health, the India Health and Wellness Summit and Awards was instituted in 2014 to achieve the vision of a healthier and stronger India. Over the past years, the initiative has gained momentum, year on year debating the very fundamentals of health, the right to good air, good water, good food and good healthcare, as well as many other aspects of holistic health. While the initiative have received wholehearted support of the leading policymakers, the Power Pack Summit sessions have witnessed the assembly of thought leaders from across the board as industry captains, community leaders, innovators, health experts, celebrities and influencers deliberated upon the opportunities for and challenges to the improvement of health-based outcomes in India. It also received overwhelming response from the industry and all those who felt for health. Several legendary brands have come out to support the idea of holistic approach and have become the real change agents. The India Health and Wellness Summit initiatives became the platform of choice to launch various impactful programs that impacted the masses for better health. Its driving philosophy of making health everyone's responsibility, taking on The fastest growing nation on the earth faces the fastest growing health challenges. With over 1.3 billion lives at stake, in wake of the swelling disease burden on the stretched healthcare infrastructure and severely compromised health of the nation, it was imperative that everyone gets talking about good health. With the objective of triggering continuous discourse on health, the India Health and Wellness Summit and Awards was instituted in 2014 to achieve the vision of a healthier and stronger India. Over the past years, the initiative has gained momentum, year on year debating the very fundamentals of health, the right to good air, good water, good food and good health care, as well as many other aspects of holistic health. While the initiative have received wholehearted support of the leading policymakers, the Power Pack Summit sessions have witnessed the assembly of thought leaders from across the board as industry captains, community leaders, innovators, health experts, celebrities and influencers deliberated upon the opportunities for and challenges to the improvement of health-based outcomes in India. It also received overwhelming response from the industry and all those who felt for health. Several legendary brands have come out to support the idea of holistic approach and have become the real change agents. The India Health and Wellness Summit.
Welcome back to the India Health and Wellness Summit 2020. Now, the COVID pandemic has claimed more than 1.6 million lives worldwide and has completely disrupted our lives in 2020. Nothing will bring back the loved ones who we have lost and those who have left us. But it will be a shame if we don't learn our lessons and make changes now to make our healthcare system even stronger. If anything, COVID pandemic has hastened the adoption of e-health concepts and solutions, which we have always underestimated, saying that their time had not come yet. The healthcare ecosystem in our country is being reshaped as we speak, where e-health and digital systems are helping to increase the availability of health services in remote areas in a no-touch fashion, sometimes by public and private partnerships, reducing the dependence on physical infrastructure, which is sometimes stretched in a safe environment. What strides have we made in delivering e-health in our country? How is the current infrastructure being used to deliver the care? With the government already working on the digital health mission, will public-private sector come together to improve access to healthcare and turn the system on its head to emphasize prevention over treatment. In this session, we are going to discuss strengthening the digital backbone of healthcare for high on tech health for all. We have an eminent panel of experts joining us. Please welcome Dr. Geeta Manjunath, founder and CEO of Nirmay, Dr. Dhaval Shah, co-founder, Pharmacy, Kunal Kapoor, actor and co-founder of Keto.org. We have Alok Avasti, founder of SeekMed. We have Chandrasekhar Civil, Senior Vice President, Medical Division, Fujifilm, joining us. And we have Saurav Agarwal, Vice President, Sales and Marketing, Lupin India, joining us. A warm welcome to all of you for joining us on this very important panel discussion on how technology is changing our lives in a good way, even after what we've been going through in 2020. So let me come to each one of you and try to understand how your product is giving us solutions that we couldn't dream of earlier. Mr. Avasti, let me start with you. Now, telemedicine is not exactly new. These were things we were talking of even earlier. What has changed in 2020? Can you tell us what is the product you have and how it has changed now versus what it was earlier?
Yeah, thanks, Anisha, for the introduction and for the opportunity. So before we talk about the solution, let's first understand the problem. Healthcare challenges in India, or for that matter in any developing country, revolve around affordability, accessibility, and quality care. And let me add one more challenge, which is around information. Now, with smartphones and internet, we have a lot of information available, but many times patients find it difficult to get the credible information. And since healthcare is such a personal matter, it deals with people's lives. So building trust takes time. So strengthening digital backbone, to me, fundamentally is about gaining that trust with the help of technology. So at SeekMed, when the COVID crisis hit, we were ready with our telemedicine platform. It is a platform that brings the best in technology and the best in medicine together. We have some of the best doctors from India, award-winning doctors. So our platform connects patients from India as well as outside with our top doctors through telemedicine. And we recently also launched a health library, which we call as India's largest health library, focusing on patient education. So that when patients connect with those doctors, they learn about their diagnosis, they have better understanding of the treatment options, so that when they connect with the doctors in a limited time, that discussion, that interaction is fruitful, and we can get better outcomes from those interactions. At the same time, we also learned a lot of lessons. So technology leaders must look at those lessons, improve on the technology landscape, improve their business processes, and then basically build on opportunities that are in front of us.
All right. Thank you for your opening comments. Geeta ma'am, let me come to you. Now, we've held a lot of shows about cancer, and a lot of chronic care was put in the back burner because of COVID-19. But you still have to treat so many people. Now, what has COVID done to what you were offering? You were offering an easy way for women to, come to know or at least test for themselves whether they have cancer or not in the breast without going through a mammography. What changed? Did you find COVID being a disruption because people are not getting out of the house? What has changed in 2020 for you?
Yeah, thanks for that question, and it's great to be part of this celebrity panel here. So before I say what changed, I'll just briefly talk about what we have done and what we continue to sort of evolve. I'm actually a computer scientist or entrepreneur, so with an inbuilt passion to solve this biggest problem in women's health, which is breast cancer. We started this startup called Nirmay 3 years ago, where we've developed a completely new way of detecting breast cancer in a non-invasive, non-contact, and privacy-aware manner. That is, when we do this test, nobody ever sees or touches the person. And it's so important for breast screening that we have now actually gotten a lot of happy women coming in for screening, right? Instead of women who would do a mammogram and cry while going back because it's extremely painful and somebody sort of, manhandled and so on and so forth, right? So that is one element. Another bit is actually use of artificial intelligence, a technology-enabled solution to have an accurate solution for early detection of breast cancer in women of all age groups, because today's technology allows only for women above 45 years of age to get screened, and there are lots of women under 45 who are losing their lives to breast cancer without any test for detecting early stage, only hand, right? By accident, they figure out that there's a huge lump and then they go to hospital and that's already stage 3, stage 4. And this is taking away more than 90,000 women in India alone, more than 650,000 women around the world. So that is what we want to solve. And then we developed this technology called thermalytics, which uses thermal imaging, just measuring the temperature, no radiation, and the artificial intelligence-led software that we have developed to have this completely automated solution for breast cancer screening. Of course, the report is reviewed by a radiologist to make sure that everything is well and clinical guidance is given. Now, come 2020 and unfortunate pandemic that we are all facing, one, as you rightly said, Anisha, people who are walking into a hospital reduced. And it's not that because of COVID, other diseases are going to sit back and sort of watch, right? I mean, these are continue to be there, right? In fact, hopefully every oncologist is now thinking sort of the number of people who have missed their cancer detection could be quite a few number. I don't have the numbers right away, but thousands of them have missed detecting their cancer because they missed the screening, right? And so at this stage, we said, okay, what else can we do? And our solution is radiation-free, which means that we can actually do it outside a hospital as well. And it's portable. It's a small device which you can put on your backpack and do. And we've done a lot of camps. So we launched this new initiative of home screening of breast health, which is the first ever time cancer screening is being done at home. And also women were actually more happy to get people, or rather the technicians come home. Of course, all COVID precautions are taken into account. And so that was a completely new launch of a service, home service that we did. Second thing we did was also to see, okay, we are experts as a team about thermal imaging and how to analyze this automatically. How can we use that to actually help control this big pandemic around, right? So using that and moving forward in that direction, we came up with a completely automated COVID screening technology. So this is about, there are lots of offices which were locked down and so on and so forth, right? So now after that, it's opening up, a lot of people are coming in. And you have these security guards, trying to look at temperature screening, do that temperature screening using infrared thermometers. And it's a lot of error-prone manual procedure. And also it's very invasive. Whoever is going by, security has to catch it off and then do it and so on. So this whole thing is automated. It's a thermal camera and the software which watches every door into a building. And as and when people are walking in, we screen, we figure out who are people who are coffee, do a face detection, and then figure out what's the temperature of each person. We have a log of so many people who walked in, this is the temperature. And if somebody has a higher temperature, we actually take an actual picture of the person and sort of, it can be tracked and, a separate case can be taken. In addition, we also do mask detection automatically, whether the person is wearing mask or not. And so we are enabling technology to, we are using technology to enable automated screening. It could be inside the offices, it can be in public places and so on. Hopefully it will help us contain. We also are able to do respiratory detection with computer vision based technologies. This is a lot of learning, and we hope we will be back to normal, or if not close to normal. But technology can really help, in many such emergency situations.
Yes, that, ma'am. Let's hope that the solutions that you're providing are going to be adapted, taken up more on scale as we move ahead, and more women will be able to get their screening done without being ashamed, without being scared, and proactively take their health in their hands. Mr. Sibal, could you tell us about your company? We all know Fuji Films. We think of Fuji Films and we think of camera, we think of imaging. I'm sure you're doing a lot of other types of imaging in the medical field as well. 2020, how has that this year changed things for you? What was the solution you had, and how has it changed now?
Yeah, so 2020, as everybody knows that it came with a very bad news of Corona, and everything stopped in the March, April, and May. These were the 3 months that we were completely locked down in our homes. So first thing we did was that to keep our employees motivated, we started with the training programs, sharpening the X kind of a program. So online programs for training them. Then our technicians, a lot of people. Definitely, we could not stop the services because we are into the COVID centers. We are having X-ray machines, CR systems, digitization, packs, IT products, endoscopy products. So we have a lot of products which are going into hospitals. So wherever physical requirement was there, we were sending our people. But definitely, our online calls were much higher, and we were giving instructions to the biomedical engineers and other people to sort out those problems because there was a problem of even traveling. Public transport was also not available during that time. And also, most of the radiologists actually also started to report from home. So the teleradiology services have taken a big thing because earlier there were no rules and regulations. So government has immediately found out, and they have given the rules and regulations. They've closed those things very fast, which were lingering on for years together. So those things were done immediately. Teleradiology, telereporting, and those kind of things. Because as you know that the telehealth and other things also taken a lot of things. That there was a 10 times increase in those kind of things. So we have also started coming up with the new solutions, cloud-based solutions, which can be installed very fast with the radiologist. And we know that we have 40,000 machines installed every nook and corner of India, every village or every small places. We have X-ray machines, and X-ray machine is the first modality where any kind of a thing. So we are starting now to connect those things, those systems, and sending those images to the radiologist. Radiologist can report, and then on the mobile phone also, patient can show those images to his consultant. So these kind of things are underway, and we are going to launch it in a big way on a cloud. All these things will be on the cloud. So cloud packs and IT related services will be launched, and there are many things which is, as you rightly said, there is a lot of increase in digitization, which we were thinking we will do, how the systems will do it, who will pay for it. We were thinking a lot of things, but I think all of a sudden, those solutions we have got for those problems were there staring at our eyes, but we were not able to solve them at that point in time. But this has given us a kind of a crisis. Crisis has given us a kind of a strength to come up with a solution very fast. So and many things are underway, like artificial intelligence, and we are now coming up our X-ray systems, or rather all the systems. The AI is inbuilt now, where after doing the X-ray you can know the COVID score. What is the COVID score? And similarly for the mammograms, we can know whether the cancer is there or not, or it is a normal report, and then the report for the mass screening and those kind of application, NTB program. So in each and everything, endoscopy also, whether the cancer is there or early stage of the cancer is there. So these kind of things are there, earlier also there, but now they are getting installed at many places and people are using them.
All right. So that's very heartening to hear, Dr. Sibyl, how you've managed to scale up in time of a crisis and, increase your services in a digital fashion, in a telemedicine fashion. So let me come to you. Now, as soon as the pandemic struck, the first thing that the pharma industry, braced itself was a cut of the supply chain. Your raw materials coming from China faced an outage. Thankfully, most of our pharma companies managed. We did not have a shortage of drugs. So, what is it that worked for pharma companies, and what are the solutions you're working for? Did you fix your supply chain in a fashion that you could predict these outages? Did you build new networks here? Are you using predictive analytics to figure out what drug will be needed more in the years to come and ensure that there'll never be a shortage? Could you tell us what Lupin has done, which is, what it was not doing earlier after the 2020 crisis?
Sure. Thank you, Anisha, for asking this. I think along with doctors or healthcare professionals, I believe pharma has played a very vital role across in terms of servicing millions of patients and even doctors for making sure that there is appropriate addressal of this, COVID pandemic. In fact, until January, people were not sure what would be the scale of this entire pandemic. Well, there were early signals from China and rest of the world that it may spread, but probably India was not as prepared, and like always, we were thinking that we may not be as much impacted, and hence the preparation levels were really low. And come February end or March, I think this pandemic really created a huge impact, and then nation went into a lockdown towards the end of March. I would say that our industry and pharmaceutical in particular has not closed even for a day. I mean, I would say right from the day one, all our plants are working 24/7, making sure that all the essential drugs are manufactured and supplied in a seamless manner. I think support from initial, like I think what Sibyl was mentioning about the fact that there were not even clarity on policies and what to do, what not to do. But very quickly, I think the system learned, and certain services like pharma or healthcare professionals or frontline workers were very quickly decided, and they were waived off from the entire lockdown. So that in a way helped us to make the logistics a little faster. However, we saw a lot of challenge because the truck drivers were not available. There are no people to lift the stock. So while we were able to manufacture at our plants at various facilities, like in India, we have 7, 8 facility and where we manufacture our products, but we faced issue of labor shortage. Suddenly, people vanished, and I must commend people who are working in plants and all across, not just in our company but across the board, wherein many of these guys have gone out of the way to do the job which they were not entitled to. People have picked up stocks physically in their own vehicles, in their personal vehicles, to make sure that they are made available to hospitals and all. And then there was a huge partnership which happened between various pharmaceutical companies as well as the entire logistics providers, to make sure that we don't do a disjointed work. Unlike in past, wherein a company would have its own dedicated, fully integrated supply chain, this was not the time wherein people had so much of liberty and luxury, because everyone was short in supply with laborers, everyone was short in supply with transporters, and therefore a couple of companies have come together to see how we can pull in the resource and start making the products move from factories to the mother godowns or depots, and from there move either through road transport or through air transport to various locations across the country. So that in one way, that collaboration between the companies has helped us to keep on top of the supply chain and make sure that products were made available. Another important thing that we realized that the adoption of various digital solutions were pretty slow pre-COVID, but just in 3 months we achieved what we never achieved in last decade. And thanks to a lot of innovation which have been done with people like I would say Alok, who have done fantastic work on teleconsultation platform, maybe the work which Dr. Geeta was talking about of advanced analytics and using machine learning and AI for better detection. And I think all of this become very handy to pharmaceutical industry as well, because we started providing some of these solutions to doctors. Finally, what happened is many of the healthcare professionals were short of many of these technology at their hand. But fortunately for us, India is always a hub for innovation. And some of these technology innovations like teleconsultation platform, patient interface, counseling and care, which is available online, we really stepped up. And within no time, I would say maybe 30 days time or so, we were able to provide some of these solutions to most of the healthcare professionals across the country. At many places, our company has also gone out of the way to support a lot of government hospital for essentials, because the government setups and even many private setups, terms like PPE kit, masks, gloves, and we were not the indigenous manufacturer at that point in time. So there was a requirement of better licensing, better supply chain or contacts across the border to get some of these things in. And I think industry has done a fantastic job in terms of getting that provided to various government setup as well as that of private setup. And then slowly, as we learned about this whole thing, we did a lot of investment on our people in terms of getting them up and running for adopting the new technology revolution which is happening because of COVID-19. In terms of how they interact with hospitals and doctors, in terms of how they provide a better care to various patients, because even now there is quite a restricted movement in many places, and people are afraid of moving to doctors and clinics and so on. And therefore, there was a requirement to provide a better technology interface, a better integrated approach to patient, wherein at one place they can get, not just consultation from a doctor, but maybe medication as well as diagnostics. So some of those solutions or platforms were provided by us, so that doctors can provide best care to their patients. And now, as we move forward, I think the way I'm looking at the future, I think the integrated healthcare system, which has connected devices, what we call as digital therapeutics, may take a big move, especially in management of chronic disease, because those are the trends which are popular in West, and we see some merit there. COVID has taught us that India shouldn't be lagging behind that. We have been innovating all of this for developed nations now. It's time for us to adopt some of these digital connected devices for management of diabetes, high blood pressure, cholesterol, maybe neuropsychiatric disease and so on, because you don't require just a good drugs or medicines, you also require fantastic monitoring system which are remotely connected. So the remote management of patients, digital or connected devices, and I think as we are readying for 5G, so as soon as 5G is here, I think the entire Internet of medical devices, what we call, should become a very leading trend, may decide the outcomes for patients in chronic disease areas. So that's what we are looking ahead for future.
All right. Thanks for the comments, Saurabh. Of course, we have a network going of, digital health, of diagnostics, of imaging, of solutions coming forth. And that's something all of us are looking forward to. Kunal, want to come to you now and talk to you about Keto.org. Now, this is a crowdfunding platform. What changed in 2020 for you? Nobody was prepared for COVID, and we've heard of stories in Delhi where even well-connected people were having such hard time finding a bed for themselves during the peak of the crisis in end of June, and they were not able to cough up. Some hospitals were outright asking for big fat deposits to even give you a bed. If people couldn't cough up that money,
Right.
some people lost a lot of their family members. So there's a lot of pain and angst. What did you see in 2020?
Well, first, let me go back to how we started Keto and the reason that we started Keto. Keto was founded on the premise that what we were attempting to do was democratize capital, which means that we came across a lot of people that had great ideas, people that needed money for medical and social emergencies, but they didn't have access to any sort of capital. The other thing that we found was that there was a lot of people that wanted to help and a lot of people that needed help, but somehow these people weren't coming together. So the idea behind starting a crowdfunding platform was to sort of build a bridge using technology between people that can help and people that need help. And the power of that I've seen over the years, of course, but I've not seen the complete power of it like I saw during the pandemic. We've raised now about 140 crores only for corona-related fundraisers, which means medical equipment for doctors, making sure that the migrants can get back home, feeding stray animals, making sure that the underprivileged are getting ration. And what I've seen during this time is that a lot of people that have never contributed in their entire life have wanted to do something but have not gotten down to doing it, have come forward and contributed. I've started fundraisers. I have friends of mine that have not been involved in the social space in any way, but they've come forward and they've started fundraisers. And that's because I think each and every one of us was moved by what was happening, and each and every one of us wanted to make a difference. And I think for us, it became clear what Keto was doing. We were providing an avenue for goodness. In the past, if somebody wanted to make a difference, it would have been very difficult for them because they wouldn't have had even though they would have had the intent, they wouldn't have had the means to go about trying to make a difference. I think Keto gave them those means. I mean, I had a friend of mine who was watching the news with his daughter. She's just 10 years old. and they saw the migrant crisis happening, and she said, I don't want to just sit around and watch. I want to do something. And he called me up and he said that, can she start a fundraiser on your platform? I said, sure. So we set it up for her in about 45 minutes. And in 1 week, this 10-year-old girl had raised 14 lakh rupees for migrant workers to get back home. So in the past, if she had wanted to do something like this, it would have been impossible for her. She would have had the intent, but not the avenue. And I think crowdfunding provides the avenue for people to come together and help somebody. The other thing, like I was talking about, is the democratization of capital. We live in a world which is rapidly changing. Technology is affecting each and every sector, the medical and health space, of course. We're talking about robotic surgeries. We're talking about genome editing. We're talking about inserting nanoparticles in the blood that will give real-time updates. But the question is, how many people will actually have access to this technology? We live in a country where the health space is anyways underserved. It's estimated that about 200 million people have been pushed into poverty only because they couldn't pay their medical bills. We have a system where people have to sell their houses, take loans to pay for the most basic medical treatment. So how many people will have access to this technology? Not many, which is where we want to step in, and we've been stepping in to make sure that this capital gets democratized so that everybody has access to capital. And if you have access to capital, you have access to, taking care of your medical bills, you have access to helping your friends and family. And right now, we as a platform are only working in mostly the urban cities, but we start going to the smaller towns. We are hopefully looking at going to rural India soon, because we believe that until and unless the most underprivileged are helped, really, there's no point of technology if it's only going to serve the 1% of the population. It should really sort of reach out to each and every one that is underprivileged and needs help. So yeah, that's what is happening at our end. And also now in 2020, we realized that we have to, because we have now access and we've built a brand, we should also start developing other technology which can help, a patient and doctor integration. So we're working on other technologies that are going to help doctors, help patients, and also help people connect with each other.
Digitally.
Digital, yeah.
All right. Thank you for your comments, Kunal. Definitely crowdfunding is, and the work done by Keto during this year is very noble and commendable. But we at IHW Council are asking, why should anyone have to pay for healthcare? The government of our country has already committed to universal healthcare. It is giving an insurance cover to nearly 50 crore people in our country. And we would like to think that technology is going to be an enabler to ensure that universal health coverage to everyone comes about. And, the government should serve us to at least cover our bills when it comes to our health. And till we get there, it's great that anyone who wants to help can do that by going on a crowdfunding site, making a contribution, doing their bit as well. Geeta ma'am, going ahead, what kind of innovation can we see? Kunal has said, what is the point of having technology if it's going to serve that one person? Do you think technology is going to be constrained there? Because we are seeing technology changing a lot of things. Like, the farmers are protesting now, but many farmers have apps that are helping them. They know the weather, they know the soil quality, they know they're adopting solar pumps. Many things are changing because technology is being adopted. Where do you see scale coming in for technology? And do you think it is not utopia that technology can be used for everyone?
Absolutely, technology can be used for everyone. I break the thing is, I also want to sort of give an example of how we have actually used it and how it can scale to several other diseases. So going back to this breast cancer screening using thermal imaging, because it's portable and so on, and also because it's automated, we said, okay, why only have high quality healthcare only to the urban paying hospital customers, and like Kunal was mentioning, why leave rural people around? In fact, that was one of the mission statements. Sarve Santu Niramya, let everyone be healthy, was the mission with which we started. So we actually went out, partnered with cancer societies, partnered with non-profit organizations to group people in the rural areas to conduct these camps. And in fact, we have a training program to make health workers, train them in 2 days to actually do cancer screening just using these software tools. And the way we had to do was also to make the automation much smarter and intelligent, because you cannot have a doctor reviewing every report when you're actually screening hundreds of people, and these people come from different villages, and once you lose track of where they are coming from, there was the first one of the cancer camps, right, and we knew that there is one Sharadamma who need to be tracked, and then we looked at the list. There were 3 Sharadammas, and after 1 week you go back and say which Sharadamma was it. We don't know any address or anything, because they just put the village name, and it's like crazy the way they write their addresses, and many of them use their husband's mobile phones and so on and so forth. So with that, we decided we can enable the technology to do automated screening in real time, without any doctor, with just the use of health workers. And can it be done? Of course, initially, we used it as a pilot, and we were also reviewing and giving the report later. But yes, now we are at a stage where a health worker can be trained in 2 days to perform this test in the remotest of the villages, with or without internet connectivity, right? And then generate this report within 15 minutes, and then make sure that people who are likely to have an abnormality, group them together and bring them for further diagnostics inside a hospital. This is the triaging, or a red, yellow, green, the traffic light output, as you call it. It's a new product we developed, it was last year, 2019. So after seeing the need, and as well the possibility of using AI robo doctor for doing a provisional reporting, right? Of course, there are some fine-tuning of algorithms that need to be done so that we don't miss any cancer or likely cancer. So this is doable. Fast forward, I think we definitely can look at different diseases which require this early screening. In fact, all non-communicable diseases, early detection is absolutely critical to improve survival rates, treatment effectiveness, as well as reduce treatment costs. So we could look at different such possibilities and develop point-of-care devices enhanced with database decision making with smart machine learning algorithms to say, okay, can I provide these like center of excellences, like make the PHCs a center of excellence and a center point of early diagnosis or screening, right? So that people can come in and do the first level of screening there. And of course, push of a button, you can actually talk to a doctor if there is any doubt. Right? So coupling this with telehealth, which was talked about earlier, and point of care devices, I think it's a tremendous opportunity to provide high quality healthcare for everyone, every nook and corner of India, if I can go ahead and say that. And that's kind of, it's my dream, and I don't know whether it's going to happen like in my lifetime, but that is definitely a possibility using especially technologies like IoT and artificial intelligence, right? So this is feasible, and and it's been proven in multiple such occasions.
Right. This is very heartening to hear, and let's hope, ma'am, that your dream comes true, and we have more and more, parts of our country covered by this. Now, I actually would like to come to the government's plan, the National Digital Health Mission. Alok, let me come to you. Now, the government has a plan, and the Digital Health Mission is already underway, whereby every person will have a health ID, a unique health ID. All of us have Aadhaar. So we have a health ID. We need a huge data infrastructure whereby the health records of each individual are stored centrally and are available to doctors, not just in government hospitals, but everywhere. This is a very ambitious plan. And even developed countries like the US do not have good success with storing patient records safely and in a way that's completely portable. This is what is being planned. How do you think this can work? And is it going to be the government's big umbrella, or are we going to see it as a public and a private partnership? Do you have a view on this?
Yeah, this is definitely a very ambitious project initiative. And you're right that even in the United States, where I live, interoperability is a major concern, right? So when patients have to go from one doctor to the other or one hospital to the other, the data, the medical records, they're not easily available. And any moment, there are number of integration touch points where data is moving from one place to another. Bad actors, they're always waiting, to grab your data. In fact, in healthcare alone, in the United States, data breaches cost as much as $4 billion every year, which is huge. It is much more than financial services and public sector. Now, coming back to National Digital Health Mission, it's very ambitious. Fundamentally, these IDs will enable, empower patients, and especially those coming from villages and smaller towns. And it will make things very efficient for them, which eventually will help in cutting cost. Other aspect of NDHM is generating a lot of data. We heard about IoT, we heard about machine learning and AI. These are all data-hungry, technologies. So I'm hoping that the NDHM, the data that we collect, will allow government and other agencies to have targeted implementations of health plans. Not only that, it will also help in things like monitoring. For example, we have all heard about antibiotics abuse. So it's there, and a lot of unethical practices are very common. So it can also help monitor, are there abuses happening around medications. So this has many different benefits that we can achieve. And for companies like SeekMed, the telemedicine platforms, they can leverage this huge database and leverage the health IDs to provide a more seamless experience to these patients who are not, may not be educated, who may not have a lot of information. So it will save a lot of time. It will improve a lot of efficiencies. So I think it's a very welcome step. We'll have to see how the results come from these 6 pilot projects or pilot states, and how government can implement across the board. So I think more to come on that.
But Alok, just if we do a little bit of hypothesizing or crystal ball gazing, I want to try and understand that let's say in the future, the government has given each one of us a unique health ID. In that, once I'm a doctor and I put in that number, I will get the entire records. So if a doctor is on your platform, are you saying that once I give him my ID, he will have all the details, and then he will be in a better position to counsel me on what I should do?
Exactly. So what happens today is that every time a patient comes to us, a patient
you
has
take
to
a prescription and you first ask, how old are you? What is the problem?
Exactly.
Yeah.
And just imagine, in some cases, your history goes back many months, in some cases more, few years. So, and what if you miss, what if you don't have any particular medical record? So at least here, it will provide access to those medical records. It will save time. It will provide those clinicians, doctors, better opportunities to provide a better diagnosis, because you have all the records in a safe manner. And I'm hoping that technologies such as blockchain would be used to store this data, because the data volume is going to be so huge that you can't store these in a traditional ways of storing data. So that will provide further benefits around securing the data. Only the doctors who deal with those patients can access data, not anyone else. So, so I think there's a huge potential for this initiative.
Right. Saurav, I want to come to you next only because, Alok has told us how to work as a patient. As a patient, when I access a portal like Saurav's Seek Medicine, and I talk to a doctor, the doctor would already have all the records. Now, say this starts happening with everyone. You would have so much patient data. You would be able to then put an algorithm to figure out, say, in Uttar Pradesh, how many people are having diabetes, what is their diet, how much medicines is required in a particular state. And for drug companies like yours, you would know what to do. So how do the drug companies, access the data? Is there conversation going on that? Because yes, well, there may be privacy concerns. When all those in the ecosystem start using the data, we will have preventive care as well. You will start analyzing the data to make a prognosis of what lies ahead and how you should then move ahead. So, what's in store for drug companies should this become a reality?
Actually, I think rightly put that first and foremost, drug companies don't access patient level data. I think that's against the privacy laws and compliance because, yes, at a cohort level or non identifiable data, obviously, we can get access from various agencies who are working with patients. But as a pharmaceutical companies, we are not directly connecting with patients unless it is for education purpose. That's what is that's the regulation that we follow in India and maybe most of the parts of the world. The way we look at this entire national digital health mission is that one, it throws open a lot of data. Second, I think what you rightly picked up, it gives an avenue for predictive analytics because today our epidemiology studies which are there in India are based on very anecdotal, small scale research which are conducted by few doctors or institutions. And we don't have a population level data for us to really know what disease pattern India is going to follow 10-year hence or 5-year hence and what capabilities we need to have either at the pharmaceutical level or even at the healthcare professional level. So we are just fighting the odds as we get to know. However, if I have access to this data, what we're talking about through National Registry of NDHM, then we will have better predictive, and our research can be directed in that direction. Our drug development can be directed in that direction, and even our tech innovations that pharmaceutical companies are there can be directed in that side, because the entire ecosystem will be trained to work with that data available. However, the big piece, which, and I'll just like to continue from where Alok left, about how successful this initiative will be. It's not just infrastructural change, if you really ask me, wherein you put a system of having a national digital health record for every individual, but we're talking of a behavior change. It's not that once you have a portal or a system like Aadhaar available, you get access of data at any point in time. It's a huge behavior change because for India and for all of us, health has never been a priority. I mean, you may have a record of your financial investment maybe for 10 years, a IT record for 20 years. For every property that you buy, you may have a record. But what you have seen for a doctor 2 months back or even a week back, you will not keep a prescription or record. So that's a behavior issue. I don't think that's about system availability. Having some form of storage and computer was available in India for a good 3 decades now. But it's a behavioral shift that one has to drive. When health becomes a priority right from a childhood, and if that behavior is inculcated, then the National Digital Health Mission will really be successful in its essence or spirit. Because while solutions, let's say today, Dr. Geeta talked about reaching to masses and identifying at a patient level what they need. But finally, the person should come to that camp or a campaign and be part of it. And once they are diagnosed with something, they should follow up and go to a doctor, keep their own things handy. But that priority suddenly vanishes the moment you get a treatment or the moment you start feeling well. So if the behavioral shift is managed well by not just government, but I think public at large, and every sect has a role to play. I mean, it has a role by government by putting a policy framework. It has a role by a lot of startups and innovators and health tech people, which we have in panel today, and population at large, how much importance we give to health, how much importance we give to, be conscious as much of what we are for education, as much we are for our financial security, as much we are for anything else in life. Are we so much conscious about health? And I think that in spirit will make the National Digital Health Mission successful in my view.
Right. Mr. Sibal, how do you view the National Digital Health Mission, and how do you think that companies like yours can also, be integrated into the National Digital Health Mission? And do you think that, one of the one of the things that patients have to deal with is the cost to treatment, especially imaging and things like that. So, do you think technology will also give us a way to perhaps reduce the cost of imaging and the procedures that require these medical devices?
Yeah, so National Health Digital Mission is a very ambitious program, as everyone has told. So my feeling is that to make it successful, as my previous speaker has told, that behavioral change is required. So a lot of things are required, and definitely with the help of this and we will be able to find out the root cause of the problem, and and also give the solutions. So like some territory or some area, if the environment is not good or water is not good, so particular kind of diseases will come in those areas. Once we have the data, we can do a lot of mining of that data. Suppose people who are just sitting next to Ganga river, and there are a lot of pollution in Ganga coming, and those people are drinking that water. From that water, some waterborne diseases are coming. So we will be able to then repair those things at that point in time. Actual reason of those illnesses, we will be able to find out. Some pollution from big factories, some pollution from a nuclear power plant, the people who are living around. Because right now, we are just guessing, and everyone who is interested in his own thing, suppose I am interested to sell my medical equipment, I will just say, this is the best, please go for it. This is going to give you all the solution. So everybody has their own vested interest, and actual data will never come out actually, and it is a problem. Once those kind of things will happen, and this data can give us democratically, like which place demographically has a problem, what kind of problems are coming, and why those problems are coming. So it is more important to find out the root cause of the problem. We can send the medicines, we can sell x-ray machines, we can sell ventilators, anything. Those things are not material actually. They will come anyway. When the business is there, our companies are like vultures. They will go everywhere and sell those machines. But the thing is that to actually transform the health of the people will require a lot of, not only the systems, but definitely use of the data to find out the root cause of the problem and then repairing those things.
Have with us Dhaval Shah as well of PharmEasy. Dhaval, you would have been hearing what the experts have said. Now, we want to find out what are your expectations of the National Digital Health Mission, and how PharmEasy could perhaps, be integrated into this system, or how you can use, this unique health ID. How do you see this working out in the future?
Yeah, no, thank you so much for having me here. I think, yes, I've been listening, and I think very interesting thoughts. So, if you ask me, I think for us, the health mission is extremely crucial. So, for example, even today, right, we're looking at there's nothing called as a digital prescription even today in India, right? For example, if a doctor writes a prescription, sends it to you over email or WhatsApp, it's actually, I mean, it's still gray whether it's a prescription, it's a valid prescription or not. Now that's something that's a simple ask, right? Wherein before, I think, see, the health mission will be split into multiple pieces, and as everybody rightly said, I think even a lot of developed countries have not been able to do it successfully. So it will be, great for us to also pace it out well. I think as step one, just digitization of records. So for example, even today, if a patient has ordered a medication on the PharmEasy platform, even 5 years down, we can tell you that what was the prescription that the patient used, who was the doctor who wrote it, what was the dosage, what was the date, etc., etc. But I think if this data is then recognized and fed into the system, which is just kept there right now, and where it can be leveraged and used later on, I think it will be great. So, for example, I think the government is mulling unique IDs even for the COVID vaccine that is going to come out very soon, and that will be great, right? You don't want people to take like five different shots of vaccination at 5 different hospitals and then come back saying, hey, you know what, I got side effects. That's bound to happen. So I think for us, I think the push from our end would be step one, just recognize digital prescriptions. Today you can get a FIR on your email and it's a legitimate document, but you can't get a prescription on your email and it's not a valid document. Now I think that's the biggest pain point that we all need to solve for. Number two, supply chain digitization, right? So, for example, we're trying to solve for healthcare problems in India. The basic premise that all of us, right, us, manufacturing companies, supply chain, the doctor experts, etc., are all trying to solve for is how can we give best care for the doctors, for the patients. Now, the simplest problem that we right now have is when I consume a single strip of medication, I don't know where it has come from. If you would have consumed, say, a ketchup in India, every FMCG product in India has a unique barcode. You can scan it, you'll come to know where was it manufactured, date, etc., etc. On pharma, there has been no barcoding made mandatory, and that's been because of the function of the industry. A lot of contract manufacturing margins are wafer thin. People don't want to spend. But if you want to export the same medication, you need barcode. Now, if barcoding is made mandatory right at the source, a lot of issues around availability, affordability can really be addressed. Authenticity can be addressed because you just digitally enabled. Simple things like digital prescription, digital barcodes and products. I think this will go a long way in shaping up the way we all think about digital healthcare solutions or, national health mission. I think we are obviously still far away from having multiple doctors look at the same report, advise, then it goes to the pharmacy. Yes, it will happen. It will happen over the next 3 to 5 years. But I think as next steps, or first steps, I would rather say these basic things would really go a long way in solving for a lot of issues that we currently have.
All right, so we've already seen, Dhaval, that the government changed a few things quite quickly as soon as the COVID pandemic struck, and let's hope some of these, speed breakers would also be gone sooner than later. Kunal, what are your expectations of the National Digital Health Mission? Crowdfunding is giving hope to people, especially when it comes to chronic or difficult diseases, to be able to raise funds, etc. For routine healthcare, for diabetes, for cardiovascular issues, if you have a database and if you have regular follow-ups which are easy, perhaps you would have some sort of prevention rather than just treatment coming in. What are your expectations of the National Digital Health Mission? Kunal, I request you to unmute yourself.
I think everybody's pretty much said what is to be said. I think we've pretty much covered everything. What I can tell you is from our perspective, from a perspective of Keto, crowdfunding platform, I think it's very important that the government also works very closely with private players. I think that's really essential because there's some things that the private players can do which are far more efficient and effective because we're dealing with such a large quantum of a challenge, right? To give you an example, we started a campaign called Milkar with the government of Maharashtra, and what we found during the pandemic was that there were some areas where all the NGOs were getting donations, were getting contributions. But then there were other areas that were completely underserved. So, for instance, there were a lot of NGOs working in Dharavi, and people felt like Dharavi needs the most amount of contribution. So a lot of the contributions were going to all the NGOs that were working in Dharavi, which the result of which was that the same household was getting food packages from 3-4 different NGOs, whereas there were other areas that were not getting food packages at all. So we tied up with the government of Maharashtra and the BMC and corporates. The idea was to build a technology solution on our platform. So what we built was a map of Bombay. And that map of Bombay was updated every day by the updates that we got from the BMC. So the BMC would tell us that this is the area that needs the most help at this point of time. So as soon as you went onto that map and you clicked into the area that needs the most help today, it would tell you all the NGOs that are working in that particular area. Mm-hmm. So once you went into that, you could select the NGOs that were working there and specifically contribute to them because you knew that that was the need of the day. Mm-hmm. We also had tied up with corporates. So the corporates were matching every rupee that was donated with another rupee of their own. So I thought it was a very sort of seamless integration of the government, the BMC, platform like Eto, corporates, and obviously individuals that were donating. And I think we need to see a lot more of that. I think there has to be a lot more integration with the private player. And I think that is something that can be very, very effective.
All right. So you've already shown us how it works when the government, the NGOs, the private sector all work together, and the digital health mission will perhaps be a success then. There are a few concerns about Alok. Some of the things which a lot of naysayers always come up with, about privacy, about data, because patient health records are sensitive, and in this year itself we have seen a number of pharma companies, drug companies, healthcare companies who have faced data breaches, which you yourself mentioned, which has cost money. And so do you think that some of these concerns are a little overrated, or are they justified? Because in our country, as of now, we don't have very strong data privacy laws. What is the way out? We don't have the infrastructure to reach everyone. We need to get to a platform that will leverage technology, so that solutions and healthcare is available to many people. At the same time, you're worried, will my data be misused? Because see, I go to policy the website to search the price of a health insurance policy. I take one, but 10 more will call me and say, do you need health insurance? So, it's okay, they're calling me for health insurance, but tomorrow they may use my data somewhere else. So, in a country where our data privacy laws aren't very, strong, should there be a worry, or do you think even that will fall into place because the government is working there too?
Very good question, Anisha. We must worry. And I think we all know that technology always leads regulations. So regulations, there's always lag there. But as India establishes itself as a leading medical tourism destination, we should not just be looking at patients who come from India, but also from all the international countries, especially developed countries. So it is incumbent on technology leaders to follow those global standards, which come in the form of HIPAA compliance in US, or GDPR in UK, or PIPEDA in Canada. I know in India, Disha Act is under review. So I'm hoping that that would be passed soon. So that should provide more clarity. See, from business point of view, I could have the most robust and most secure company in the world, but then it would be very difficult to do business with. So it's finding a balance between flexibility and providing security. Now, a common man from a small village or town will not understand the meaning of data privacy. But then when we set our standards, we should not be looking at that as a benchmark. We should be looking at meeting what those global standards are, right? And why wait for government to decide or tell us, about regulations? We know what those regulations or what those guidelines should be, right? So I think it's upon us, for technology leaders, to take a step and stay ahead of the curve, because the cost of not doing that is huge.
Mm-hmm. And Dhaval, like Alok said, that it's upon us to take proactive steps. Our own companies will take those proactive steps when they export or they interact with companies based in the UK, because there the laws are strict. So why aren't they doing it here right now? What are they waiting for? The law?
So, see, we can all debate on this till, we end this debate. But I'll tell you, see, in India, we've had issues that plague us, which are maybe need more priority than maybe data privacy. I'm not saying it's not important, but for example, just availability of TB medicines, right? This should have been solved like 10 years back. We shouldn't be having issues which are unheard in other countries. I would be okay, and again, this may sound politically, but I would be okay if my data breaches happen, but every Indian in the country gets medicines at affordable cost that they need. If you're able to prioritize availability, affordability over everything else, I think that's what even the government obviously is trying to solve for, right? I think you have to balance it. say, for example, as I said, right, your barcoding is a simple solution, but it adds to your cost. That adds to your availability and affordability in the country. So we'll have to innovate in ways which is very well suited to our nation. So, for example, HIPAA compliance, as Alok absolutely mentioned, but I think, uh, I mean, see, HIPAA is again a self-regulated modality. It will take us 5 to 7 years to actually come up with our own HIPAA standards. It's tough. In a country where 99% of prescriptions are handwritten, having a digital backbone is very, very difficult. But we can take steps which can drive us to those end outcomes, which can be, as I said, um, ensuring that there is visibility, track and trace, just ensuring that people do not abuse the system. I think small checks and balances can go a long way. But yeah, I think I'm sure the regulators are looking into it, and we should expect something soon.
Gita ma'am, where do you see this? Do you think that too much emphasis on privacy is like missing the wood for the trees in a country that's starved of healthcare and it is so underserved? What do you think?
Yeah, I think I agree with all of the panelists' opinion on this, and it is a very complex subject, and particularly when you're trying to sort of balance availability and accessibility with privacy. One can decide which side is compromisable. Having said that, it is not very difficult to put light regulatory framework in place, because what are we talking about? We're talking about a platform, right, where every hospital may actually sort of put in some kind of data. They've already sort of trying to define the protocols, having a POC of it and so on. So at the time of entry, sort of just have some kind of a gatekeeper, if you will, right? One time, when you register a hospital, which is contributing data to it, you have one gate, certification, right? Saying that this is what's called as ISO 13485, which is a well-defined regulation, which says that whoever is doing what they're doing, they know what they're doing, especially if it's a healthcare system. So a small startup like us, Nirama, which is just 3-year-old with 50 people, we are going for an ISO, we have almost done with ISO 13485. And after that, I can tell you that if anyone is serious in doing healthcare business, they better be conformant to ISO 13485. Otherwise, you're not being sort of, you can't take things for granted. Things very simply because you are playing with end user data. It could be as simple as providing the right kind of medicine to that person. Forget about the privacy angle, right? So once you have that framework in place, maybe all you have to say is only companies who are ISO 13485 compliant can come in. Plus, here are the 3-4 ways in which we would like to check one additional SOP, standard operating procedure, which ensures that your sharing of data, follows. There are certain things that whenever you share data with anybody else, like you would have an outsourcing process, have a sharing process or whatever, there may be some nicer names for it, right? And then see, this is the one extra SOP that I'll need beyond your ISO 13485. It's not just for, adding data in, it's also about, taking data out. That I think is definitely doable. I mean, we should not ignore that. Like saying availability is more important. In my opinion, it is possible to put this small regulatory piece in picture. The second piece is also, I'm very excited when, Saurabh and Mr. Sibyl was talking about use of data there. It's not just about, all the data is in one place and the patient can access. There's humongous opportunity with the AI and data analysis that one can do to enable better healthcare outcomes itself, right? For example, I know a company, what they're doing is to just look at what are the different prescriptions the doctor has for these kinds of symptoms. The same symptoms, what was their earlier prescription? So almost they give you a, checkbox saying, okay, this is the medicine you gave 1 month ago. This is the medicine you gave for, the same doctor, because he tends to do. And then say, okay, decide. So it can also help in treatment planning and making sure that, there are no mistakes done, because everything is human error at the end of the day. So the overall quality of healthcare delivery itself can be humongously, improved as well. So I think we need to look at the data analysis and artificial intelligence based analysis that you would do for predictive, and you can give many things, say that you are due for a screening right now because 1-year-old screening is what you had, and so on and so forth, right? So it also helps in keeping the overall health of the ecosystem itself very, very nicely. So I think it is possible to put some small policing, and you shouldn't lose that, but it's an excellent step that government has taken.
Right. Sort of you were smiling listening to the,
Yeah.
the speakers.
I think
What would you want to say?
what
Because
happened is,
Geeta ma'am has said nobody should be in the business if you're not serious about patient privacy. So you don't have to conform to what's in Europe, but at least have minimum standards.
I mean, I was smiling for the fact that, we at certain occasion we are so sensitive about privacy, and at certain occasion we just give away privacy for free. So what happens is it's very subjective, and at times it becomes political discussion instead of a real concern for privacy. I mean, I'm just wondering, when you're giving example of, you searching for an insurer, and suddenly while you're searching for one, you get a call from 5 guys. In a way, if you're able to get a better product, okay, has it really impacted your privacy, or has it able to help you get a better solution? I think that's the trade-off one has to really work for. And I'm not subscribing to the view that there shouldn't be a strong privacy law, but at the same time, it should not be overhyped. I mean, one has to really understand that there is a journey which the country is going through. I mean, this is not going to happen overnight. There will be hackers, there will be breaches, but let's look at the bottom line. I mean, in a way, if we are able to serve a population well, if we are able to get things to the place where we want to, I mean, one has to live with all of this. I mean, 2 days back, we got to know that Google had a trouble with their whole system, right? There are 3 Indian companies got hacking in last 1.5 months. What does it mean? Does it mean that you should only have firewalls and you should just keep strengthening? Not that you should not work on IT security, but at an overall level, if the impact is not very significant and if it is manageable, one has to keep moving on. In fact, instead of really putting a lot of barriers and being too much worried about, because even when you're talking of NDA, HM, the digital record and registry for all the patients, we may encounter this as we go forward. We will have issues. When I was hearing Dhaval talking about barcoding and all, will the industry come forward? Industry will come forward for sure. People are willing to do it, but does it mean that we will not have any counterfeit? I don't think we would be ever be able to claim that. So we will have counterfeit despite of having barcodes. We will have issues of supply chain still, despite of having known the last mile happening or not. One has to be ready for the change. I mean, that's the whole point. And when I was talking about all of these changes, it will have some cost. But net of it, you'll have to figure out, does it benefit population? Does it benefit those who are otherwise not getting access to the system? So today, if Dr. Geeta is able to reach to the rural population where breast cancer was not diagnosed, and by that effort, if she is able to identify 10 women and able to provide them good health care, I mean, I think that's the end point. No, we are looking at a better outcome. I think that it need to be balanced. Not that again I'm subscribing to that there shouldn't be privacy loss, but at the end, look at the end point. I mean, if it is serving population at large, it helps. I was on my laptop and suddenly it conked off. I had to switch. Now, can I expect that things will be all smooth all the time? It doesn't happen. I mean, you'll have to have option 2 ready, and I had to keep my phone handy, logged in through that, and I'm in again. So, and I think in our journey towards digitalization, these things will keep happening, and one has to be ready to accommodate and adjust to it all the time.
Right. Mr. Sybil, in the future, how do you foresee a company like yours working to innovate quickly to the need of the hour? Say, you have digital records of patients and you use analytics to figure out that going ahead, perhaps this disease is going to increase here. So we should deploy these kind of imaging or these kind of devices in this particular area. Could you use data to innovate quickly and hence move quickly? Where do you see this entire digital backbone taking us and changing the face of delivery? Will it also improve quality of delivery?
Yeah, surely. Actually, first and foremost is digitization is going to give us the democratization of the things that services can reach to those people very, very fast. We will be able to diagnose those problems. We will be able to connect them to the right kind of a doctors. So that is very, very important. And for innovating also, for AI to become more and more smarter, we require more data. So uh, the thing is that data security, the concern which everybody has told, and my feeling is that data belongs to the patient, and which rightly said by the government also. And Dr. Indu Bhushan, I was reading his article, and he told very clearly this data is basically for the patient, and it is not a property of a hospital or any diagnostic center or any company, whosoever is making equipments or anything. So basically, it is his data, and it is up to him. He can give his passcode to anyone, password to any doctor. Suppose he's going to Apollo Hospital, then Max Hospital, or any other hospital, and he can give his password, and then the doctor can enter and see his records. So we have to keep it simple, and also anonymizing of the data. Like when we need a data, we don't need the name of the person, name of the patient. We only need a complete data from which we can take out the reports, and our computers can think that what kind of a disease are there, and then they can develop the faster thing. So it will definitely help us to get more data, access to the data, but it will all depend upon the policies of the that how government wants to share those data and what are those policies. Because there will be many people who will be saying why you're providing this data to companies, but if you will not provide to the companies, companies will not be able to work on the data. So it will all depend upon the kind of a trust factor which is there. So there has to be some trade-off between that. Security has to be there. Definitely data security is important, but after anonymizing of the data, when the name and everything is gone, then you will not be able to know whose data is this, and then the companies can utilize those data. So those are the simple things which we can do and move forward.
Right. Kunal, you said that Keto is a platform that provides capital for those who need it. Now, are you also, funding innovation or simple solutions to complicated health problems? What are you foreseeing going ahead? How will your platform help to make healthcare services perhaps more reachable for people?
Well, first and foremost, like I said earlier, is as a platform, what we do is just connect the buyer and the seller. That's what we do as a platform. How much innovation happens on Keto really depends on how innovative somebody that's starting a fundraiser is. It's really not dependent on us. What we found is that most of the campaigns that are funded on Keto are medical campaigns, usually because when you have a medical need, it's urgent and it's a matter of life and death. That's when you're likely to see a lot of people come together to support you. You might have a product that you want to launch in 8 months, 9 months, but that might not feel like an urgent need to somebody that wants to donate. So that really then comes down to how innovative the product is. So I think if we want to see innovation, if we want to fund innovation, first we have to encourage innovation. I think that's really important. I think it's very important to encourage entrepreneurs that are doing something that is very, very innovative. I mean, we found it that a lot of products on our platform, health products, have been funded, but they've been funded. So it's a really sort of strange mechanism. We had a couple of people that came on the platform that wanted to start something that was very innovative in health. They reached out to investors and they got no response from them. Then they came onto a platform like Keto and started crowdfunding fundraiser. People reached out to them, donated to their fundraiser. Once they raised that money, they actually found a lot of investors coming to them. And that was because the investors then had a proof of concept. The investors then found that people were actually interested in the product. So I think it's a bit of a innovation first has to be encouraged before we see capital flowing towards that innovation. And I think that's something that the government has to do, is to come up with the areas, identify areas where this sort of innovation can happen and can be encouraged.
Right. So
also coming back to what everybody's been saying about data is that, I'd love to ask everybody, where does sort of data breach end? And where does, it begin? Because today we live in a world where you have health trackers, you have apps that have all your information. You have, women have pregnancy apps which monitor everything, all their periods, their sexual activity. You have different kind of apps that's already monitoring everything that you're doing. So who sort of defines what data is accessible and not accessible, and what is sacrosanct and what is not sacrosanct? So how do we sort of identify that? I think that's something only the government can do. Otherwise we're
and we
already.
also,
I mean, we're already
Kunal,
being
we will also have that
constantly.
choice, right? We should also have that choice
No,
of
but I'm saying
the
somebody has to
privacy.
sort of define what that is, because when we're talking about privacy, I think our privacy is already, in the hands of a lot of apps now, and it's already being used. So, where does that sort of, who defines what is okay to access and not access? We can't do that as individuals, maybe, but maybe the government can.
All right. So at close, I'm going to take one parting shot from each one of you on what you want to see going ahead and how technology will change things. Alok, I'll start with you. One liner on what are you most looking forward to?
I'm looking at technology, as I stated in the beginning, to build trust. As most of our countrymen live in small villages and towns. So if we can reach that barrier, I think then technology can really reach its potential, true potential. So, and with things like language barriers and other things. So I think that's something that I'm looking forward to from technology point of view.
Saurabh, one thing that you're looking for that technology will change in the future?
I think I'm looking at better partnership between public and private, because I feel there is a phenomenal potential. And second, technology with ease of what maybe something like WhatsApp offers to everyone, wherein it can actually reach to the last person who deserves it, so that all the benefit what we're talking about don't get restricted to the top 1%, what Kunal was talking about, but it actually reaches the masses. So partnership of public and private, and simplicity in technology which is accessible to everyone. That's what I'm looking forward to.
Geeta ma'am, what are you looking forward to in the future? That one thing that you wish for that technology will solve?
Yeah, it's bridging the healthcare divide that is there for high quality healthcare in the rural and this, using technologies which are self-diagnosing, right? Which are able to do some kind of automated diagnosis at the corners of India.
Dhaval, your wish list, that one thing that you want in the future and technology will make it happen?
No, I think just availability of healthcare. I think in a country like India, I think that's extremely crucial over everything else. I think it's just making doctors, medication, healthcare services available at the right time, at the right price. I think that's what I'm looking for.
Mr. Sibyl, what are you looking forward to? That one thing?
I'm looking at the democratization of the healthcare and accessibility of the healthcare to everyone at a very, very low price. And technology is going to do that.
All right. Kunal, that one thing that you were looking for?
Well, I think two things. One is connection, and the other is equality. I think when I talk about connection, people being connected to each other, doctors being connected to patients, patients being connected to capital. So I think connection is really important. The other is equalization, which I already see technology doing. I mean, today, earlier education was accessible, say, to very few people, high degree of education. Now you could be sitting in a small town or a village, and you could be on your smartphone, and you could access information that's accessible to anybody anywhere in the world. So I think technology is already playing its part in connection and equalization. I hope to see a lot more of that.
All right. A big thank you to all our panelists for joining us today and discussing with us how technology can be used to leverage healthcare solutions and to improve access for everyone. In the future, we hope, we'll see a lot more of good quality healthcare going to all those who deserve it, and it will be technology that will make that will be the enabler to make this happen. Thank you, Alok. Thank you, Geeta ma'am. Thank you, Kunal. Thank you, Saurabh. Thank you, Mr. Sibyl. And we want to thank Dhaval as well. He's had to drop off. But thank you all for joining us. And please stay with us for a minute. Kamal Narayan, the CEO of IHW Council, is here. He wants to also address you.
Thank you so much, Anisa. It was a wonderful discussion. And one thing, I can be sure that in this post-COVID world, all of our panelists who were in this session on technology are definitely going to be playing a very, very important role when it comes to ensuring the healthcare reaches to everyone, everywhere. We can call it anything: bridging the gap, democratization of technology, availability of healthcare. But one objective which the post-COVID-19 world, or beyond that or before that, has been very clear, that health should reach to the person who need it, and wherever, whenever he or she needs it. So I'm sure that technology is going to play a very, very pivotal role on that. And so thank you so much, all of you, for joining us and sharing your wonderful thoughts and a wonderful work which you have already done during the COVID-19 time, especially Kunal for sparing your time. And also it was very heartening to know that in this last 7-8 months of lockdown, your platform could help mop up or aggregate more than 140 crore, I think you mentioned, for corona related causes. So that's something which definitely gives a big hope, and I'm sure would have provided really very, very critical support for the people who needed it. So I would, in general physical event, we give some kind of memento to thank our speakers, participant, so for their participation. But in this digital event we can't do that, so we have created some form of doing it. So I will request my team to show the memento and the certificate of thanks to our speakers today. So Kunal, thank you so much for your time, for your inputs, for your insight, and the wonderful work which you are doing for the benefit of people. Thank you so much.
Thank you. Thank you so much. Thanks. Lovely speaking with everybody, and thank you.
Thank you. Also, Mr. Alok Awasthi, thank you so much for your participation, your support and contribution, and also for leading this technology revolution of the country, connecting patients, doctors, and people who can provide help, and who people who need help. So thank you so much, Mr. Awasthi, for your work.
Thank you, Kamal. Thank you, and it's an honor to be part of this journey.
Thank you so much. And we especially thank your organization SeekMed for helping us in putting this program together. So thank you so much for that as well. Also, thank you so much, Mr. Chandrasekhar Sibal from Fujifilm. Thank you so much for your participation and insight. And I'm sure the kind of work you people have started doing in helping people, accessing their amazing records and all that. So thank you so much for your partnering today with us. Thank you.
Thank you. Thank you. Thank you very much for giving us the opportunity. Thanks a lot.
Dr. Geeta Manjunath, your work in the area of breast cancer, patients, and for helping them, it's wonderful. Thank you so much for your continued patronage. We heard you during our breast cancer awareness month, the initiative, which was a 1 month long initiative which we undertook to encourage action in the area of breast cancer. So thank you so much for your continued work, and I'm sure you are going to bring a lot of important intervention for the people who need it.
Thank you. Thank you for the opportunity to share.
Dr. Dhaval Shah, I think, has dropped out, but thank you so much to him as well for his participation in time. Mr. Saurabh Agrawal, thanks a lot for your participation and your work which you are doing in Lupin, and helping pharmaceutical companies are very important aspect of healthcare system. Many times we forget that aspect. We focus more on doctors, but a good doctor can only help us when they have good medicine with them. So thank you so much for all the work which you and your company is doing.
Thank you, Kamal. And thank you, everyone. Thanks, Anisha, for a great session. Really enjoyed being here.
Thank you so much, everyone. So the next session will be, conducted by our co-founder and also global health advocate, Dr. Bobby John, with another esteemed group of panelists. Over to you, Bobby.
Thanks, everyone.
Thank you very much, Kamal, and to the esteemed panelists from the previous panel. Thank you for your time to engage with the audience and with us here on the Integrated Health and Wellness Council platform at our flagship event. Your presence here means a lot to all of us at the IHW and also to all of us who are tuning in from our various places. In normal times, we would be sitting together in some auditorium or some venue where only a limited number of people would gather. But these are not normal times, or these are different times. And so therefore we have people together on a computer screen, but without the limitation of the number of people who can tune in. So therefore, to all those of you who have tuned in from wherever, on whichever digital line that you have been able to access us through, welcome. And I hope over the next 1 hour or so, the conversation that we'll have will be profitable to you, as well as enjoyable to our participants on the panel. And I quickly run through the names. It's Mr. Manoj Saxena, who's the Managing Director at Biocidus Pharma. And as I say your names, if you can just raise your hands, that'll be fine. The audience will know who you are. Dr. Prakriti Pradar, has she joined in? I don't see her on the screen as yet. Dr. Manjari Bakre, founder and CEO of OncoStem Diagnostics. Mr. Abhishek Sharma, co-founder of Goki. That's him there. And Ms. Pooja Bedi, actress and founder, Happy Soul. And I don't see her on screen as yet. If we may be waiting for them for a second or so. But that's fine. I mean, I have a message that says they are logging in. We will not waste our audience time or the panelists' precious moments. The framing for our hour's worth of conversation is very simple. And I'd like to capture it in this. A stitch in time saves 9. If you do things well in time, if you're able to anticipate events, or if you're able to understand where a particular trajectory is leading us to, and we're able to intervene early, we have a lot more of health in our hand than when we intervene later. And so therefore, I'd like to start with Dr. Manjari. 2020, I think, has been a landmark divide in the way we will see healthcare. It'll be before 2020 and after 2020. And you're kind of in a space where you're uniquely looking at a lens where every individual needs to be provided this specific care that they deserve. Public health, of course, thinks in terms of the best care for the largest numbers of people at the lowest cost. You're saying that that paradigm can change in the world of precision medicine. How do you square the goals of precision medicine with the big idea that everybody should be healthy post 2020? Welcome.
Sure. Yes. Yeah. Thank you for this opportunity. It's a pleasure being on this panel. So how has, I mean, in short, you're asking how has COVID changed the way we work in times of pandemics, epidemics, using and role of precision medicine in it, right?
Yes.
Yeah. Okay. So let me just begin with briefly mentioning what is precision medicine. So, it's very clear to our audience. Let me share this slide, share screen, and then,
I'm not sure whether that may be possible, but just go ahead and explain to us. Yes, it's there.
Yes.
If you can full screen it, please.
Yes,
Yes, thank you so much.
Yeah. Yeah, so this is essentially what is precision medicine. So on the left hand side of the slide, you see so this blue, yellow, light green, dark green, these are various patients. And without personalized medicine, they all are given one green tablet, and some of them benefit, some of them don't benefit, and some of them have even worse, which is adverse effects. So what precision medicine helps you in short is to understand each of these green, blue, light blue patients individually, understand their disease very well, whether it is cancer, it is heart disease, it is something else, and then treat each of these patients accordingly. So the green patients will only get the green tablet, and these patients will get some mixed tablets or different kinds of drugs, or the navy blue patient will get some different kind of drugs. So this is exactly what precision medicine helps you do by doing biomarker based diagnostic. They can be genomic, they can be proteomic, they could be radiological, so there can be multiple ways of doing this precision medicine. So this is essentially precision medicine, which is to explain to help diagnose the disease in a lot of depth, so that you can treat the patient based on the tumor, based on the disease specifically. This is not to say that, you know, for every patient we will come up with a new drug. That's not what precision medicine, because that would be very too many combinations. But to categorize patients into certain categories, basic categories, and then treat them. For example, I'll just explain that with the example of breast cancer and the role of precision medicine in breast cancer. So breast cancer affects, as you know, like millions of women across the globe, all over. In India specifically, the numbers are really high, about 1.8 per year number of cases. Now, for some of those breast cancer patients, some of the therapies work better than some of them don't work. But how do you know that? That is by doing the biomarker analysis. And so based on the biomarkers, so about 70% of patients with breast cancer will benefit from a endocrine therapy, that is anti-hormonal therapy, that is known. So only those patients will get the anti-hormonal drugs, rather than giving it to every woman who comes down with breast cancer. Similarly, there are other targeted drugs in breast cancer, like a Herceptin antibody drug, which is only given to patients who have HER2/neu receptor on the breast tumor cells. So this is again what is precision medicine and how it helps. Now coming to the latter part of the question, which is how does it how has it helped in pandemic, right? And how will our practice change in future? So it has, I think the precision medicine has helped a lot during the pandemic. So as you know, the whole any cancer, for example, is a process where you screen the patients, you find the tumor, you do biopsy, and then you remove the tumor completely from the body, and then you decide whether to give the patient radiation, chemotherapy, etc. Now, during pandemic, what was the situation is all the hospital beds were occupied with COVID patients, and all these cancer patients are immunocompromised. So if they go into the hospital to do chemotherapy, to do screening, then they might acquire the infection themselves. So these were the issues. And how did the community solve these problems is by really choosing patients. So now whom do we screen in this patient population, whom to screen whether they have breast cancer or not. So if we have longitudinal familial data, whether some families have run the mutation of BRCA in the family, right, then help them come up for screening. Some patients who have already finished biopsy and the tumors are big, then instead of coming to hospital for operation, give them treatment before surgery to shrink the tumor. So all this is achievable by doing what's called precision medicine, and that's
absolutely. And I get the drift here, and I hope to kind of I hope the audience also understands that we are moving towards a point where what we will be looking at everybody as unique individuals.
Correct.
You may have unique characteristics, and so therefore what is eventually prescribed to you is more tailored towards your uniqueness rather than towards a one-size-fit-all kind of an approach. And that may be something that then becomes a close partnership between those that work at the bedside as clinicians, those that work in the world of assisting a good diagnosis through greater precision, and then the people who actually manufacture the drugs or produce the therapies to be able to work in tandem. And that is something that goes a long way towards correctly identifying and correctly delivering the appropriate care. However, that is still 2 steps down the line. It does save a lot of angst down the line for a misapplied treatment. But what if we were able to apply precision heuristics or understand who's heading in a particular direction? And this is where I would turn to Abhishek Sharma. I mean, is there a way from the world of Goki and the kinds of data that you're picking up from people, are you able to say some are more likely to get into trouble, and so therefore here's a red flag, or here's a yellow flag, or here's a different kind of a flag that you need to kind of have so that you are avoiding that particular journey?
Hi, Bobby. Thanks for having me here. Uh, so first of all, briefly, I will explain in 2 sentences what we do. So we are a complete health ecosystem. We are not in the space of, I would say, medication. We are in the complete preventive space where we use data to help user make a behavior change towards a healthier lifestyle so that their chances of getting sick reduces. And as you rightly said, the data is very important. So I would go back 1 step to your previous question, is what the impact of COVID has been on the world, or the world perspective towards health and the importance of preventive health. So it has changed 2 things. One, it made the people realize they have to be responsible for their own health, and have to take the preventive measures to stay healthy, because otherwise, if it's like if your body is weak, anyone can attack you, right? Any virus, any hunger. So you have to be strong internally. Secondly, the importance of data, right? Today, if you look at it, every household since the outbreak of COVID uh, at least have a thermometer, and some of them, even most of them, even have an oximeter, right? Because the user today, or the consumer today, is getting more and more awareness towards the importance of data and how it can be used, right? I'm sure all of us who have been the panel themselves and their extended family have been a time when we have checked our temperature multiple times during a day, was cautious about whom we are coming in contact with, checked in terms of it. So the whole impact of data tracing, contact tracing. So this is not nothing but just the data. So what we do, and there has been a lot of work which the team has done in the background, specifically for the COVID, since the outbreak, is that we accumulated a lot of data of our users. We upgraded our devices, so we do have our own variables, right? So the first device which we launched at the outbreak in April had the capability of monitoring the body temperature continuously. So we equipped our users so that they can be aware of any, I would say, fluctuation in your body temperature, right? So, because it's not that, you get a fear. So as soon as you are on the brim, your body gives an indicator. And body temperature is one indicator because your body is fighting that virus and, try to overcome that. So body temperature. Then we upgraded our devices further so that we can enable users to get more data. We upgraded it to another device, which is in the market right now, Smart Vital, which also has the capability of capturing the SpO2 level on the go, right? And what the ecosystem does is it uses all that data and give it in a very precise and clear manner to the users so that they can be aware of what their body is going through. If there are any abnormality, the ecosystem and the platform make them aware that they are at risk. There is an alert system which is in place. We have, I would say, deployed this solution in various frontline workers like Mumbai Police, Pune Municipality, and a lot of others. So roughly around, I would say, 10 to 15 frontline bodies are using this solution to monitor and to be preemptive about any kind of the risk these workers or the frontline warriors get into it. Because if we are aware of the data or the predictive analysis, as would we say, coming out of the data, the more equipped we would be able to handle any kind such situations. Also, what it does is utilizing the data and the behavior of our users, we are able to even guide, nudge, as well as make them more aware about how they can build up their immunity. Because at the end of the day, it's all about immunity. If your body immunity is strong, and I would say thankfully Indians have better immunity than most of the developed countries, and that's why if you see our death rates fluctuate between around 1.5%, whereas countries even as advanced as US or UK are above 3%. So it is less of a reactive things which comes into a picture of giving a medication or doing a treatment, but also how strong internally you are. So we also work with our users through the platform and through the coaching and guidance and nudging. What we do is how they can build up their system to be stronger. Right. So it's a combination of, I would say, the technology as well as empowering the users and using their technology and how we work with it. So the data gives in terms of an insight, equipped me to be more predictive, more forward-looking, whereas the insights and the ecosystems or the other elements of coaching, videos, content enables them to make those changes so that they stay safe. That has been, our modus operandi has been with our users, because if you look at the country like India, fortunately, we have good immunity, so that's why we are able to cope better with this thing. But unfortunately, we don't have that much of infrastructure support that if we would have a bad immune system, the infrastructure could have supported it. It's only the preventive health, I would say, is the way forward for any COVID. Because see, COVID is one of the the first viruses. If you hear the scientists all over the world, there will be a lot more to come in the future, right? Sure. Because all the mutations and all the exposure which is happening.
Yeah, sure. I get the point. I get the point that prevention is definitely the way to go forward. And then from what Dr. Bakri had said earlier on, I mean, intervening earlier with better insight is actually the better way to go forward. I turn to Manoj Saxena while I see Ms. Pooja Bedi already on the screen. Thank you very much for joining us. Manoj Saxena, you're representing a company which is almost like a double-barrel gun. I mean, storied names, Bayer. I mean, aspirin, if anybody takes aspirin, it comes from Bayer from the 1800s, to Zydus, which is one of our storied companies here, and you've got both names attached to you. When you're hearing two people who are talking precision medicine and early preventive thing, where does that leave a company like you, albeit with something that is today talked about as magical, aspirin, for preventing many, many things? Where does that leave you, and how do you think the pharmaceutical world kind of takes in a prevention approach?
Thanks, Bobby, and thank you for having me. See, healthcare is a multi-stakeholder topic. I don't think only pharma company or doctors or diagnostic lab alone can play a part. Yeah, we all are working towards one single mission, that to give the benefit to patients. I think that's where what we exist. And over these years, Bayer has existed because of looking at innovative solutions to manage the disease well, give better quality of life. So I see moving forward also pharma industry's role remains absolutely paramount, and more so now, and you're seeing in COVID as well, at least the lay press is also being aware of the challenges which pharmaceutical research is under. It's a, now coming back to preventive health. Yeah, the way I look at it, and I think this, the popular slogan since our childhood we all hear is prevention is better than cure. But I think somewhere we all feel that, cure means of curing a disease, but not on complications. And I'll give example of to help you understand in terms of why prevention is important at every stage. Yeah. Diabetic patient, prevention is better than cure if he continues to manage his diabetes well, in check, he avoids complications of diabetes. So for them, prevention is better than cure. But for a healthy patient, if he manages his lifestyle, diet in a better manner, probably he can delay diabetes. But if he has both the parents diabetic, probably he will get diabetes. He can't really prevent 100% diabetes. Yeah. So I think from a understanding of prevention is better than cure is something which depends upon where do we at what point of time we are looking at prevention. Yeah. But definitely, I think any disease, and particularly for NCDs, any disease, Bobby, it's a given that the attempt of the stakeholders, and I'm very happy that the government of India is with looking at whether it is Swachh Bharat Abhiyan or now safe drinking water, or I mean the whole initiative against the health, yeah, is targeting a section of society which does not have access to a lot of things. And I think in that, focusing on setting up centers which are wellness centers where there are trained staff supporting it is extremely important. The other common slogan on health is wealth. Yeah. And I think as a society, we should now change it saying health should be more valuable than wealth, because, and I think that's critical for us. And sometimes we just raise this slogan, but really don't think in that fashion. And the third thing which I want to say when we talk about prevention, I'll come back, let others also comment, is I think it's important to understand for health, there is no magic wand. Yeah, all the stakeholders have to come together and work together for long. And I'll give example. Yeah, anemia is a big problem in India, right? 1970s, we have this national anemia program. But the data which was published just last week of the NFHS survey number 5, the women who are suffering from anemia have risen from 49% to 57%. The child between the age of 6 months to 5 years, 70% of children are anemic. Now, I think that is where the prevention should be. How do we make people greater aware of it? Yeah, and I think giving analogy of endemic is good. Most of the people are now aware of using masks, hand sanitizer, washing their hands, social distancing. But when it comes to anemia, people may be thinking during pregnancy, okay, I should take a proper pill of iron and prevent anemia. But not many people know if they are anemic, it leads to higher chances of vital organ complications, even heart failure. And I think that is very important for health, that we have to stay invested. As a country, we are not spending enough amount of money on healthcare infrastructure. Our percentage GDP spend is very, very less. As a country, we need to make sure that we should listen to patient and make him empowered so that he can make a choice and not anyone else decides for them. So I think those are the nuggets which I think are extremely important, but we are heading in the right direction. I think the government thinking around prevention and doing a lot of stuff there.
Thank you. I mean, many interesting points there, but I want to kind of take one line because it kind of gets me a segue into into the next guest that we have. You're saying that there is no magic wand for health. And then I have Pooja Bedi here, whose tagline goes, magicians of wellness. And I'll hold that for a second. But just before I ask her to speak, I mean, very interesting that you point out that it is multi-sector. It is multi-stakeholder. It is not about hospitals, doctors, clinicians, and the paraphernalia around them. Health starts a long way off before you even begin to see a hospital. And health really means you shouldn't be in the vicinity of hospitals too much. It has to be a lot more experienced at home. And how do we ensure that? We've heard from Abhishek Sharma, if we can monitor things early on, and there's a whole plethora of technologies that are available today to get physical signals in a collated fashion that allows you to say, look, there is something that is going wrong. Or should something go wrong, there are now newer technologies, as Dr. Bakre and OncosQuest have kind of shown, that it could be possible to pick up the signals much earlier, so that you're not chasing different kinds of solutions when really something else was the matter. All that tells us that you can intervene earlier, but these are not magic wands. But the magician of wellness, who dwells into the mind part of it. I mean, so far we've been kind of getting signals from the human body and trying to intervene there. I mean, how do you square this? There is no magic wand with your tagline, and how do you kind of enable mental well-being?
All right, is it me now?
Yes, that's you, Ms. Bedi.
All right. So thank you. It's wonderful being on this panel. Apologies for the delay. Wi-Fi in Goa is not the best. Having said that, I'm so happy, firstly, that we are discussing wellness in a much larger manner and on a wider platform home and reaching out to so many people, because I think COVID has kind of made everybody extraordinarily aware of the importance of wellness. Now, when I speak about wellness, it is not necessarily what we call physical health. Wellness is holistic. So when you talk about wellness, you're talking about your physical wellness, you're talking about your mental wellness, you're talking about your emotional wellness, you're talking about spiritual wellness, you're talking about sexual wellness, you're talking about financial wellness, you're talking about social wellness. All of these forms of wellness fit and surround us constantly. And if we are not, and if any one of those aspects of wellness are dysfunction in our lives, it leads to a dysfunctionality in our system. So when you kind of explore the entire correlation between your thoughts, your emotions, and disease, it's really astounding as to what an important role your mind plays in your disease. There's no formula. I know as a society and as human beings, we love boxes. We love these little compartments that we put everything into, and everything has to be in this particular manner. Medical world has its own place because it's validated. It's sciences that are validated. And I come from a realm which amalgamates sciences and meta-sciences. So we're not completely into what you call the energetic woo-woo sciences, so to speak, but it's a very logical, scientific look at meta-sciences and the role that we play in our entire well-being and our healing and wellness processes. So say, for example, the power of the mind in creating an emotion which then becomes stressful, and the stress then gives rise to different reactions in the body, which therefore cause disease. Now, if you research this lady called Louise Hay, she had a book out called Heal Your Life. And in this book, it's almost every single disease alphabetically listed. Any ailment or disease or affliction that a human being could have, from acne to cancer to diabetes to heart problems, it's the works. And everything has an emotional reason as to why it triggered in the human body. It's very neatly formatted, and it's wonderful to keep an open mind, because at the end of the day, if we box ourselves, we're not opening ourselves up to greater realms. Like, for example, Ayurveda and homeopathy. We're so focused on the medical world, we're completely ignoring how incredible Ayurveda and homeopathy can be in treating COVID. You're not even allowed, unfortunately, in the world of Ayurveda and homeopathy. And I know many of my homeopaths and Ayurvedic doctors have attempted so many times to reach out to the government, but somehow internationally there's like almost a ban on speaking about how incredible Ayurveda and homeopathy can be in treating COVID. Whether it's bryonia, whether it's other medications that they're dispensing it to patients, but they can't publicly announce that these will actually arsenic album 30. Nobody's actually speaking about the fact that these are great preventive medications, and also they really help your immune system. I mean, there are so many ways to frighten people into taking a certain allopathic medication, but there's no basis by which you can actually go out there and invite people to try an alternate form of medication that can actually help them. And I think that's really unfortunate. I think when it comes to sanitizing and putting the fear of God into people, we look at the farmer protests. There are the largest human protests in history. I mean, where's the social distancing there? You should imagine that they're all affected en masse and that they're all falling like flies en masse, but that's not the case, is it? So you have to turn around and think that there is something, there is some truth to concept of probably herd immunity. There is the concept that our bodies are so naturally tuned as Indians to be resilient to certain bacteria and certain viruses and certain strains. People come from abroad in highly sanitized countries and they fall ill within a day or two of landing in India because the immune system can't cope because they're so highly sanitized in their countries. In our country, we're used to the exposure. Our bodies learn to be resilient. Our bodies learn to fight back. Our greatest strength is our immunity. And basically the focus should be on building your immunity, keeping people scared, right, keeping people locked down, keeping them in financial distress, keeping them out of sunlight, keeping them away from exercise. These are not ways to build your immunity. These are ways to lower your immunity. So what we're doing by a lockdown is essentially causing a nation of people who are going to fall sicker and sicker. A lot of the old people in this country have suffered immensely with the lockdown. And I'd say that's largely because of the inertia, the lack of stimulation, the lack of social life, the lack of everything, because, as the lives have no meaning after a certain age, and now you've taken away every purpose that could possibly be in their lives. So now you're talking about the old people, like my father-in-law to be, who just perished and passed away within 3 weeks of being bedridden after fracturing his femur bone, because, it's so it's so unfortunate, that we've taken away life and joy and living away from an entire society because we're so focused on pharma and a vaccine, and the fear psychosis that we inflicted upon not just our nation but across the world for that matter, and
Right.
that's certainly not healthy in
We
any
can,
manner.
Yeah, thanks, Ms. Bedi. I mean, thanks. My condolences on your loss.
Thank you.
Many of us have lost very dear
Absolutely.
ones in an immediate circles or in our families or people that we know, and it's been an extremely stressful time. And I go back to where you kind of began with, that health is many things. And as I go back to the founding statements from the WHO preamble, which is health is not merely the absence of disease, but complete physical, mental, social well-being, and so social encompassing many aspects of it. But here's a couple of things that I want to kind of address the audience who are listening to us. I mean, we've had four panelists who have kind of presented their perspectives on it. One from the world of looking at how do we ensure that people get the right kind of therapies when they are in a sick situation. Earlier on, if we can get the right kind of signals from the human body by way of preventive measures that we can take, to understanding that it's not just one set of interventions that will make sense. It will be many interventions that Manoj Saxena has kind of so eloquently put it. Everybody has to work together so that things kind of are actually translating into health for individuals. And it's also a function of how much we prioritize and spend on it. And Ms. Bedi kind of getting this holistic picture that many things need to be functioning for an individual and a community to be saying that it is experiencing wellness. I just want to underscore a couple of things here for the audience, that everything that we prescribe or that we suggest as useful needs to pass the cornerstone test or the touchstone test of evidence. And that's where I come in, and from my perspective as a public health physician and policy engagement perspective, that if something is subject to evidence, and if it passes the evidence test, brilliant, that should be available. And anybody who proffers a solution needs to also be open to that scrutiny. And that's how science advances. That's how our collective well-being advances. And if we are shy of putting our solutions to the test of evidence or rigorous analysis, then we will run into difficulty. And it doesn't matter whether Bobby says it or whether Manoj Saxena says it. It has to kind of come to a thing. And so therefore, when we kind of turn around, Ms. Bedi, I'll come back to you.
Yeah.
When we kind of come back, I mean, I just want us to focus on this whole realm of people feeling well. And we've seen a spate of people who have been, over the last year, you've said, for people being in lockdown, feeling like they are in a box, they're not able to think clearly. Many, unfortunately, have taken their lives, and people feeling it's all bleak. How do you begin to address that and prevent it in a country that's less on resources and more on the problem itself? How do we begin that?
I mean, I give my workshops across the country where I talk about the power of your mind, the power of positivity. I mean, I do these intensive workshops that basically help people change the way they think, right? To view the glass as half empty, half full. It's nice to just say that as a quote, but how do you actually change your headspace into seeing life differently? So I conduct these extensive workshops in such fields and enable people and empower people across various stratas of society, which I've been doing continuously through the lockdown. I just want to put something out there, which I was trying to interject a little earlier. I have nothing against the pharma companies. I think everything has its space. I think everyone must work join hands and work together.
Absolutely.
Pharma basically can, for example, if you have a cancer and you go and, you've got 4th stage cancer, it makes no sense to start at holistic level, and start to analyze why you got it, because cancer's taken over way too fast. And at that point of time, perhaps you would need to go in for a chemotherapy or multiple sessions of chemotherapy, but also lace that along with sciences that enable your body to heal faster. right? Also, a lot of medical science, a lot of pharma deals with the symptoms of a problem, not actually the root of the problem, because in wellness, we believe that every illness and disease has a root and a seed. So no matter how many times you try to kill the cancer, it will keep recurring if you don't go back and deal with the root of it. So there has to be a certain openness of mind, even in terms of the medical industry, in viewing certain different aspects which may be considered woo-woo, but and not defined sciences or not validated sciences, but to keep an open mind. I mean, for example, why is it that Pfizer is touted as, wow, they're coming out with this vaccine and everyone worldwide wants to take this vaccine, when now suddenly people are having these crazy allergic reactions to it? The CEO of Pfizer himself has not taken the vaccine, and they're all these murky spaces happening there. Why aren't we equally allowed to pump up Ayurveda and homeopathy, and talk about that?
And
Why is there such a dividing line, saying that we will not advocate this, we will not talk about this, we will not even try these, or the government will not even put it out there as potential cures, but we will happily do that for a Pfizer that is completely, as we can see, not giving 100% result, and even then there's no guarantee once you have the vaccine that you'll ever not get COVID. So why are we so close-minded is what I want to know about our alternative sciences, and especially coming from India, a land that is the land of healing, nature, cure, and Ayurveda. And why are we not pursuing all of this? Why are we close-minded about it?
Dr. Manjari, you're in the realm of precision medicine. You're in the world of delving into the minutiae of what works and what does not work, including to the fine tailoring of what is the intervention that happens. And I want to kind of jump off from where Ms. Devi has literally thrown the challenge. I mean, why are we not kind of looking at the things that are homegrown? And why is it that that we are reluctant to go with something that is here, with a marked preference for something that's coming in from, let's put it, say, big brands and stuff like that? What's a scientist like you? How do you kind of approach it from the perspective that there is this offering and there's a perception, and we still haven't kind of squared the conundrum here?
Right. So I think it's a very complex question, and there is by no means I belittle alternate medicine. In fact, I myself take it for certain conditions. So it does work for certain conditions, and it doesn't work for certain conditions. So as Ms. Bedi also said, that if you have a stage 4 cancer, then trying to get homeopathic medicine is not going to work. What you need is like a chemotherapy, which will kill all the fast growing cells, because it needs to act fast. So now, given this background, why they are not in the mainstream is also, it's a very complex, Ayurveda, for example, it's a very complex system of medicines. Each of those medications have multiple components in it. And what we don't know is today is lack of evidence. I mean, everything in allopathy is evidence based, and that's how it should be. But when you and it's very known. Like there is only one imatinib compound in a tablet, and that works on patients with blood cancers. So it's very one-to-one correlation. So in Ayurveda, that has been our biggest handicap, is the standardizing of the drugs, the chemicals, in such a manner that because they are the origin of the drugs is from plants. So it is complex to really narrow it down to exactly what is there, what is not there, to figure this out. And I guess that is one of the reasons why they are not so well represented in the terminal illnesses. Although there are, for skin allergies, homeopathy does work. So in a milder diseases, yes, but in major, when it's really life death situations, the Ayurvedics and homeopathics are not absolutely mainstream. For, I think, mainly the basic reason is we need more evidence, which will directly link them.
Let me give you two examples. I mean, two herbal medicine examples that have saved lives and that have become pioneering and then should show us the way as to how we need to go forward. One is Chalmogra oil. Okay, many of you don't even know what that means. Comes from a tree, was the first step towards addressing leprosy, and became the mainstay for anti-leprosy treatments. Okay, The other one that I kind of pick up and is today the benchmark for treating malaria comes from the Chinese herb chingasu, which gives rise to, after a lot of work, both Chinese herbal medicine and others kind of talked about the benefits of this plant for curing malaria. But it took the pioneering work of a Nobelist to translate or to identify the active principle and translate it into artemisinin, which today becomes the mainstay for malarial treatments worldwide and has saved millions and millions of lives. And that's all we're asking. It's not about the competition between one pathy or the other. It is submit what is a potential cure to an evidence test. Let's run it. Let's identify what specifically it is. And then the magicians at companies like Zydus can actually then say, this is how we can take that plant molecule and make sure that it runs through in a standardized production format, see whether it works in trials with human beings, it is safe, it is effective, and therefore then regulators allow it a free pass. Not
So, Bobby,
without restrictions, not without restrictions, but with care, so that there is no harm. And if there is harm done, to the points that you have raised earlier on, Ms. Bedi, if there is harm done, the regulators and the environment essentially puts a brake on it and says, hey, look, wait a minute, what's happening here? And so that's where I want to kind of place
so
it.
When Pfizer has allergic reaction, shouldn't they be putting the brakes on that as well?
Sure. So let me kind of hold that for a second, and I'll come back to you because I heard Abhishek kind of jump in between. So that's within that ecosystem that we want to kind of humbly say that everything, even an early signal from a device like Goki, is it valuable? If it is valuable, can it be reproduced in every situation that it is there? How do we kind of then say that this is a life-saving device or this is something that we need to have in more hands? That is what we would want to kind of do. Abhishek, you wanted to say something.
Yeah, thanks, Bobby. So I would like to, broaden the spectrum over here a little bit, right? At the end of the day, what we are talking about is the longevity, right? How do we live longer? How do we live healthy, right? And there has been multiple research on that. There has been the research done in Europe on the village in Italy where people are centurions. There has been multiple research done on how people able to live 80s and 90s and 100s beyond, in the region of Japan and how they have been. So it comes down to the 5 basic principles, and that's what I started before about how can we be more preventive. So if you look at it, it comes from sleep, right? And I don't think there is less evidence today when we talk about the importance of sleep. It comes about the importance of right nutrition. It comes about the stress management and the mental health, with Ms. Bedi is also talking about. It talks about your social behavior, right? How social you are, how how interactive you are. It also comes about your cognition, right? Your mental health, your mental awareness, and that's all lead to your longevity and build up your body, right? So when we talk about the preventive health, it does not mean we are talking about taking an Ayurveda or homeopathic or an allopathy, right? These are all fields of medicine which are there to cure a particular condition. When we are talking about the population health, we are talking about how can we prevent that happening, right? Once the damage is done, let me put it that way, there can be various solutions to it. There can be from the house of Zydus or Pfizer or allopathy on this thing. But the question what we should be getting more aware about is that how do we stop it, or rather reduces the chances of happening it, right? And for that, there is enough research and enough evidence is there, right? It comes from the, all, from the Asian scripts to the latest studies done by the WHOs of the world, and, all the research saying that, these are the 5 pillars, right? You eat right, you sleep right, you keep your mind engaged, you manage your stress, and you stay socially engaged and happy, leads to a better life because your body builds up immunity. Your body stays healthy to kind of gives you, I would say, ammunition to fight any kind of an external factor, whether it could be as deadly as cancer. if you look at the studies which have been done on what has led to the and sudden outbreak or the sudden cause of cancer in a healthy human being, the studies have shown that in the last 18 to 24 hours, the person has gone through some kind of a mental trauma, which has led to compromise of immunity, which has given, a kind of an ammunition to those cancer cells to develop.
Sure.
Right. So it's the end of the day. It is how you use your body. Your body is very strong. Your body is the best piece of engineering the world has. Right. What the use of data is to identify what your body is telling, right? And how, what are the areas where you're lacking, and how do you build upon that, whether it's a sleep, whether it's hydration, whether your nutritions are not right. Is that what the data adds value to it? Data on its own is not magic, right? Data, how you use that data to derive a certain results is what creates magic.
Right. So let me turn to Dr. Manjari. I mean, you had put a slide right in the beginning, which I want to invert right now. That slide showed who should you give the right treatment to. If I were to kind of paraphrase that in a particular way, is there a way, the workflow that you have, does it also apply to a way to diagnose people who would be more likely to be in trouble? Is there that world that's also opening up right now?
Yes. So you mean holistic? So there are
or precision diagnostics or heuristics.
Yeah. So there are companies in the US. There is Foundation Medicine. There is 23andMe, and in India there is Map My Genome. So they are doing this. It's called the Map My Genome, run by Anu Acharya in Hyderabad. They do what's called Genome Patri. So they're trying to analyze your genome and trying to tell you what are the potential diseases you may get, you may not get, who are your in your family, how are you related to various people with, etc. So it basically, 23andMe does a lot more genomic analysis. Like they tell you family tree, you're related to him or her and all that. They go back. But essentially that is a really broad and very generic level of precision medicine, one can say. So in terms of telling you in future you may come down with XYZ disease. So that is available at the general level. I mean, this is not to say will I get colon cancer or not, but it will tell you. Yeah.
And so if you have those kind of signals, and if you have physical signals that the Goki ecosystem kind of generates for you, you're able to kind of put yourself on a risk matrix and basically say, I need to be careful. I need to be watching how much I'm sleeping, or whether I'm getting enough sleep, and the quality of sleep that I'm getting, or how much of water I'm drinking, or how much I'm putting out every day from my body. And then that kind of gives you a sense of where you might be feeling better or on a trajectory towards not being so well. Manoj Saxena, when such things happening around in the world of precision diagnostics, a lot of data coming along, how does a company like yours, and you've got multiple divisions, you're on the buyer side of the story. I know that there is another side of your company which is right now actively engaged in getting us a new vaccine for COVID-2. How do you kind of respond to it, and what do you say prevention? How do you kind of put yourself in the prevention conversation?
See, at the end, the society looks at it, what is impacting them, right? Why do you use iPhone or Android phone? Just because it helps the user. Yeah. And I think the same is true for healthcare, whichever segment you look at it. Yeah? At the end, the patients should have the power to decide what is good for him, provided he goes to the right clinician, whether it is allopathy, Ayurveda, or anything. I think that's and it's on the regulator to decide which is the right treatment, what is the right treatment. I think what we are invested in is essentially around investing so that we have good evidence around safety and efficacy of any drug. Personalized medicine, we are invested heavily now in gene and therapy, which is the next round of looking at personalized medication diagnostic. See, there are markers, as Abhishek was saying, look at from a data point with, and if you look at any data point for diagnostic or for treatment, at the end, if somebody has diabetes and you give him a medication, how will you know whether the medication is working or not? Till you subject him for some test, whether he's taking an Ayurveda medicine, whether he's doing XYZ. And any prescription in diabetes start with first two things are exercise more. Yeah, and I think that's where the Goki helps actually, right? Exercise more, whether the treatment is there or not there. The second is have good wholesome meal or diet. Plan your diet in a manner which, and the third thing is whatever medications are there. Now, the critical aspects for medications are, irrespective of which medication it is it helping the patients to get back to the desired level, right? And that's where you have to undergo individual diagnostic test, simple diagnostic tests like fasting glucose, HbA1c, to a little bit trickier if the kidneys are involved, if the eyes are involved, if the liver is involved, if heart is involved. And I think those are the sort of then, any clinician will look at it, whether the drug is working or not. And as an industry across the board, I think everybody would look at it, whether this drug is effective as well as safe. And there are many mechanisms which every country's regulator, policymakers, as well as executor, dispenser has put in place to look at it. Is it working or not? And I'm sure a patient will not take a drug if after 6 months of taking a drug, his diabetes is not controlled. Yeah, if he is religious in adhering to a therapy, adhering to the diet plan, adhering to exercise. All the three are important. And I think what Pooja was also illustrating was that, yes, we have seen that, and Ikigai is a good way to look at it from a Japanese perspective. But believe it or not, our life expectancy in India is less. Our infant mortality is higher. Our maternal mortality is higher. How can we improve that? Is only looking at all the three components together, along with what are we eating, whether the anemia example, which I look at it, how much exercise are we doing to keep ourselves fit, and are we adhering to the treatment, what the right qualified healthcare practitioners have advocated to us. And pharma companies play a significant role in looking at any disease, and as we move on to the newer data, looking at what is the best for individual patients, whether it is cell and gene therapy, which I have spoken of, or any other therapy. So I think that's where the key role of research-driven companies is to invest in research so that there is enough data so that people can look at the data and see what is good for their patients. Yeah, and then the regulator looks at it. Is it good to be allowed in a country for example, for commercial usage? Yeah.
Right. So, which is where then I kind of turn to Ms. Bedi, and I think she has not quite said it the way I'm going to say it, but I'm going to put words into her mouth, and then ask her to respond. Is that essentially when people want to be reassured that they are either on the path of wellness, whether it's in their mind, whether it's their body, whether it's their community, they need somebody who's assuring them that what they're saying is good, is verified and verifiable, and there is an accountability to it. Is there a body of people? Is that a service, or is that something that you would see more of? And how do you kind of, as magicians of wellness, how do you want to kind of expand that body of people who may draw on different disciplines and interventions, but are essentially giving an assurance and are also accountable for what they're kind of giving?
So once again, we come right back to exactly what I've been trying to say, is that why is it that we just blanketly give the world of allopathy a tick mark and the world of alternative science a question mark, right? So no, I'm just elaborating here. Sure. Because at the end of the day, I think when you talk about assurances and you think you're going to a doctor for assurances, the fact is, I think from research, it says that misdiagnosis is probably the third or fourth leading cause of death. Okay, worldwide. So, I mean, I don't think that going to a doctor is actually any assurance of any kind. I know many, many patients and many, many people who've gone into the medical stream, in the medical system, and been treated for, gone to operate a shoulder. The drugs given to help the pain have affected their liver. The drugs given to help their liver affected their kidneys, which then affected their lungs. And, they just said, to hell with this, got out of the hospital and just, went off to wellness to make themselves well again. Now, I mean, I know that there's a very strong role that allopathy does play in healing and helping people get better and saving lives. If you have a certain blockage in your heart, you're not going to go to wellness, you're going to go to a doctor and you're going to go get an angioplasty and you're going to get those things done. There is a role for everything. Yes, I agree. But as human beings, we have to also be aware that the system in which we live in, for example, we are surrounded by EMF, whether it's our mobile phones, whether it's our microwave ovens or our televisions, we're constantly exposed to harmful radiation that will affect our body on multiple levels. Now, what are we doing therefore to counter that? When you talk about the importance of sleep, are you going to go and pop a tablet, which then may give side effects or get you addicted to it? Or are you going to go into a world of wellness where you inhale perhaps lavender essential oils, or have chamomile soothing tea that calms you and puts you into a state, or listen to perhaps alpha binaural beats to put you into a lovely meditative headspace, or perhaps meditation? So what are the options that you are choosing in order to get better? Or do you blindly turn to the world of allopathy for answers? When we also talk about healing, and even when you talk about plant medicine for that matter, when you talk about haldi and the incredible beneficial healing powers of haldi, we also have to realize that everything has a biotope. Haldi is very, very medicinal in certain regions where it's grown with certain flora and fauna surrounding it that creates a certain resilience in that strain of haldi. Not all haldi has that level of medicinal power, right? So when people blindly go and eat tons of haldi thinking that it's got curcumin and is going to give them, you have to have about half a kilo of haldi to have 9 nanograms of curcumin inhaled and ingested, and mostly when it goes to the digestive tract, is mainly flushed out. So there's a lot about wellness that needs proper researching, proper awareness as well. It's not blindly go one way or blindly go the other way. We all know, for example, as a society, I think we need to change a lot of things. We all know that smoking kills. Every packet of cigarettes has this big thing on it: smoking kills, cancer, all these horrible visuals come on these packets of cigarettes. But we won't outlaw cigarettes. At the same time, we will outlaw marijuana, which is used worldwide and being accepted for healing cancer patients and being a medicinal use. We have to really look at why we are banning certain things and allowing certain things even as a society, which talks about getting better, it talks about protecting its citizens, and at the same time we're putting out so much misinformation and making products that are harmful available to you and products that are actually beneficial for you made illegal. So we need to really take a good look at wellness. I love what Minali said. Minali, was it? Who spoke about DNA. It's amazing. I mean, I was a brand ambassador for a DNA company, and they basically tell you what it is that you could have possibly inherited on a low risk, moderate risk, and high risk, and what you can do to avoid triggering those genes in your system. So what are the different forms of eating? What are the different forms of exercise you can do to perhaps not trigger those particular genes, that particular DNA that is come down your into your body. I think those kind of sciences are fascinating because it's empowerment sciences, and more needs to be explored about sciences like that. I don't think there's enough that has been discovered about the world of wellness. I'm so glad that people are talking about wellness more and more. I'm so glad, unfortunately, due to COVID, that people are getting this incredible focus on wellness. Wellness is a $6 trillion industry growing at a 30% rate. It's a huge industry today, and people are turning to it more and more because they're suddenly seeing the healing power of all these incredible sciences. And yes, it's not a one size fits all. There are different ways to stimulate different parts of you. When we say you inherit a disease, you don't actually inherit a disease. In certain meta-sciences, you inherit the thought process that creates a disease. So say, for example, diabetes. Diabetes is, if you read Louis Hay, caused by great bitterness, a sadness. The sweetness of life has gone. Now, when you have a parent who's constantly bitter about things and bitter about life and bitter about the system or bitter about everything, your child will automatically inherit that thought process and learn to be bitter or cynical about things. You learn so much from your parents. You're not actually inheriting the disease. You're inheriting a thought process that triggers the disease. So once you start actually getting down to the details and depths of these meta sciences, realize how incredible our minds are and how our minds are responsible for all the emotions and therefore all the physical ailments that actually trigger in a system. And sure, you can go out there and treat diabetes once you reach a certain state and you need to take these insulin shots. But how about going back to the root and saying, all right, let me change my headspace so that I can get my sugar levels down and soon be off the bloody insulin and lead a normal life, because that is
Absolutely.
possible.
And a traumatic childhood is also fairly correlated with eating disorders. And if you do have eating disorders, or if you do engage in unhealthy eating, chances are you're going to do a great deal of harm to your islet cells in the pancreas. Okay, and therefore you do get onto a trajectory of diabetes, whether the abuse in the mental space is directly correlated with diabetes is a questionable one. But whether that predisposes you towards a certain kind of behavior that then puts you onto a track for diabetes, that definitely is something that's much more on firmer ground. But what is absolutely fascinating from hearing Ms. Bedi here is this, that there is an incredible focus on wellness. You mentioned a number, 6 trillion. Nobody wants to be unwell. Nobody wants to be in a hospital. And if at all they are in a hospital, they want to get out of it as soon as possible with as little damage as possible to themselves. And that's what I believe the entire world of pharmaceutical sciences and clinical sciences are geared towards. First, do no harm or do the least possible for the situation that is in front of you. If we can avoid it, if we can pick up signals early on and steer people towards preventive behavior or mitigating behavior, all the more better, because you save 9 if you put 1 stitch in time. And so therefore, that seems to be the mantra that people seem to be taking on very, very seriously. As we go forward, I think this is only going to grow. But as it grows, I believe the amount of information, clean information that's required around what constitutes wellness and the contributory factors towards wellness will also need to be a lot more defined. We cannot have hearsay and we cannot have claims that will constitute the body of wellness. It has to be a little bit more than that. And that's my humble appeal to everyone. When you hear or when you get a WhatsApp forward saying this works, please do correlate it with other evidence. And if it does not square, do ask someone. Do write in. I mean, each of the panelists here have their websites on. They are each resources for you. Square it out with them or square it out with your healthcare provider. Square it out with somebody whom you trust, who knows this a little bit better than you. And if it passes that test, sure, go ahead and take on that prescription or that direction with care. Because what works for X may not work with Y, which is what Dr. Manjari's opening slide was. There is no universality. We may have best fit lines, but we may not have specifics for everyone. Companies, when they do clinical trials, when they do take the utmost care to devise their solutions, they try and do it so that they are fitting as many people as possible, which is why when you look at package inserts from companies, they tell you a long sheet of things that are likely to happen, but for most people, it won't happen. There may be the one odd case that happens. And for that one person, it will be a huge tragedy. And so therefore they flag it. And that's their responsibility. The regulator requires them. Their own work ethic requires it. And so therefore, as we begin to wrap our conversation, let's kind of get to this point for us in the audience. Prevention is the way to go. If you can sleep well, there's no greater gift that you can have. If you can eat well, and eating well today is probably a question of being able to afford it. And that kind of opens up a whole other plethora of issues around it. Are we earning enough? Are we spending correctly? Do we have the correct information to spend our money correctly on? If we can sleep well, if we can eat well, and as importantly, if we can move around well and give our God-given bodies a little bit of the exercise it desperately requires. Sitting 8 hours on a chair isn't what our bodies was designed for. We were designed to move on 2 legs with 2 hands swinging around. If you can do that, you'll sleep well too. It's kind of a related cycle. And then therefore, you'll be in a much better frame of mind. You'll wake up smiling rather than grumpy. Even if a little bit sore with your muscles, you'll get used to it. Don't focus just on the weight. Focus on your overall well-being. And if you can smile at your neighbor, and if you can be at peace with your better half, and that does not just mean your wife, it means your husband too. Or if you can be at peace with your children and they with you, you have the beginnings of what Ms. Bedi said, a holistic worldview of well-being. Because health is not merely absence of disease in your body. Health is physical, mental, and social well-being. Many, many factors come together. Even though we have a magician of wellness with us here, as Madam Saxena earlier on pointed out, there is no one magic wand to get to health. We may have precision tools with us, with which to tell us which path to take. Or we may have early guideposts on our journey that tell us through the Goki system and the many such like, that these are the pitfalls to avoid and these are the bumps along the road. Take all of them seriously. And above all, take life a little bit lightly. A lightness of heart makes you go a long way further along. Thank you all to my esteemed panelists, Dr. Manjari, Manoj Saxena, Abhishek Sharma, Pooja Bedi, for spending this hour with us. I'm sure the people who have been with us online for this conversation would have had many things to pick on. There could have been a few confusing points too, which is where I'll point you back to seek advice. And when you get good advice, stick to it. Thank you. Over to Kamal.
Thank you for having me.
Thank you so much, Bobby, for wonderfully summarizing this very, very insightful and exciting discussion which we had in the last 1.5 hours. And, what I can make out of it is that we are talking about many voices, one mission, making India healthier. And here many voices, many framework, many paths to move towards a healthier, happier, and I think more productive future. That is what is coming out from what our panelists have highlighted here. So thank you so much, everyone. Ms. Pooja Bedi, Mr. Manoj Saxena, Abhishek Sharma, Dr. Manjari, for joining us on this very, very special session, which you made very special. In a normal physical event, there is a tradition of giving mementos, but that is not possible in a online event. But we have found a way to recognize and to appreciate, and also to put some kind of responsibility on all our panelists by recognizing them as ambassadors for good health and well-being. So I will request my team to show the mementos or a kind of letter of appreciation or token of appreciation from IHW Council, which kind of put this responsibility as well as appreciate the work which you all are doing as health and well-being advocate. So Mr. Manoj Saxena, thank you so much for your time, effort, and all the work which you are doing to promote health, to help people live healthy.
Thanks a lot, Kamal. Thank you, and happy to be here. Yeah.
Welcome, sir. Ms. Pooja Bedi, thank you so much for sparing your time. Definitely, you bring that charisma to the whole discourse. We were seeing a lot of comments on Facebook, reacting to your various advices. So wonderful. And definitely, the work, kind of work and the kind of, promotion you are doing in the area of health, in well-being and wellness, absolutely one of the most important aspect. And we definitely need to go back to our roots of seeking well-being as part of our, natural life and, the culture. So thank you so much for being with us.
Thank you so much. It's been an absolute pleasure. My company is Magicians of Wellness. My brand is Happy Soul. And for all those people who are watching on Facebook or Zoom or wherever, please do visit www.happysoul.in. We are a portal for wellness. Everything's on there. I'd be delighted for you to log in and tune in and learn everything that you need to know about the world of wellness. Thank you.
Wonderful. And also for being our supporting partner. So thank you so much. Your logo of Happy Soul is also here in this memento. So thank you so much for being here.
Thank you. Thank you.
Dr. Manjari Bakre, thank you so much for your participation. And, we had you earlier also in our breast cancer awareness action month. And certainly a wonderful work which you are doing by integrating technology, by making the diagnostics of breast cancer, is other cancers and all medical conditions. Thank you so much for your work, and looking forward to continued engagement with you, and a lot of kind of contribution from your side in making India healthier.
Absolutely. Yeah, I'm delighted to be part of this panel. And my company name is esteemed Diagnostics. Please do visit the website of the company to know. We develop tests to assess whether the patient would benefit from chemotherapy. So this is again a precision medicine company. Not every patient benefits from excessive chemotherapy, and as Ms. Bedi said, the side effects are actually worse than, rather than treating the disease, you get more affected. So please do visit our website www.oncostem.com.
And thank you so much, Mr. Abhishek Sarma from Goki. Thank you so much for the wonderful brand which you have come up, and the kind of device you are democratizing, the kind of preventive control we can have on our day-to-day life, making us move more. Thank you so much, and thank you so much for being with us. And I'm sure your organization and the brand will continue contributing a lot more in the well-being of our people.
Thank you. Thank you for having me.
So thank you so much, everyone. As we move forward to the next session of our India Health and Wellness Summit, the 6th edition, our flagship program, which advocates for good food, good air, good water, and good health, good life for being a healthy, happy nation. So thank you so much, all the speakers. We really appreciate your participation. Over to you, Bobby, again.
Thank you, Kamal, and thank you to the panelists from the last session. It was really wonderful to have each of you. As much as it is wonderful to have our new panel with us, we have Dr. Lakshmaya from the ICMR National Institute of Nutrition. We have Dr. Bhavna Sharma from ITC's Nutrition Science Department. We have Ankita Marwaha from the Nutrition Science Department of PepsiCo. We have Seema Jindal Jajodia from Nourish Organics, Dr. Rajan Shankar from the India Nutrition Initiative at Tata Trust, and we have Dr. Meera Agnihotri from the WWW Foundation for Women Empowerment. Thank you all for joining with us for this afternoon, the last of our sessions for this summit. We were closing off the last session with 3 fundamentals. And I want to repeat that, and then I know that we'll be focusing on one of them. We said that if you can get a good night's sleep, you have one major component of your health covered. We also said that if you can get around and not sit on a chair for 8 hours a day or more, you are in a much better place than you otherwise would be. And the one thing in between, what we said was, if you can eat right and well, your triad is doing pretty fine. That should leave you feeling better in your body. It should enable you to get up with a smile. It should enable you to interact with your neighbor and your spouse or your children or your parents with a lot more of positivity than otherwise if you were not sleeping well, or if you had aches and pains simply because your body was not in the right shape. For this hour or so, we have experts. Many of them have got nutrition science and nutrition, all of that. In fact, we have a National Institute of Nutrition head also with us, all focusing on nutrition. And I want to kind of begin by opening this conversation with you, Dr. Lakshmaya. The last session, somebody did mention about the newly unveiled NFHS 5 results too. And only to point out that while we have increasing amounts of food available in this country, it does seem that we don't eat as much or well, because anemia among women doesn't seem to be going down. It seems to be creeping up. And that seems to be a problem. So also for children. What is it that we should be doing that would change that trajectory?
Good afternoon, sir. Shall I start, sir?
Yes, please, sir. Yes. What should we do to change that trajectory?
Yes, yes. Good afternoon. So, Dr. Baby John and Dr. Shankar and all my co-panelists, and I'm very much privileged to join with you. Very eminent experts are available now. So, because all are involved in the nutrition and welfare and good nutrition status of people of India. Actually, sir, as you said, correct, because recently even NFHS 5 results also out for 22 states. Another 14 states we are waiting. But in that, we are definitely we are suffering from triple burden of disease in India because one is undernutrition, we can PEM, including child stunting, wasting, and other things. And third, and second one is mostly majority of people are suffering from micronutrient deficiencies and hidden hunger, and almost in throughout globally more than 2 billion people are suffering. But in India, half of the people are suffering from one or the other micronutrient deficiencies like iron, iodine, and vitamin D, B12. And recently, we have also studied B12 mapping in India. Surprisingly, B12 is not that much problem, but it is the problem is more than 30, one third of people are suffering from even B12 deficiency. So that the concept of well-being. So the concept of well-being may not be applicable everybody now at present situation because and different grade of grading of people is living in India because the one blanket type of advice or recommendation or supplementation may not work because different groups of people are there. We have to handle or we have to start interventions with different type of population that different nutritional grading. As I said, because the three things are very important. That one is the sleep, and another one is good food, balanced diet, and third one is physical activity. Indirectly, what you said, sitting 8 hours in one chair, and that may not be possible. We can several advices are there, but every 1.5 hour, everyone should stand up and just 5 to 10 minutes. You have to walk here and there, and again you sit.
Right.
How many
Dr.
people
Lakshmi,
are
I'll hold you there.
Yeah.
I'll hold you there, sir. I'll hold you there because you've said two things, and then I wanted to kind of deflect that to Dr. Rajan Shankar here. One, you said the concept of well-being may not be applicable to all everywhere in this country because the data kind of tells us that there is something wrong with how people are in their nutritional status. And you said also that one size may not fit all, which is the same intervention may not be useful everywhere. Dr. Rajan Shankar, you've got years of experience. You work with most people here on the panel too. I mean, where do you take those two comments that Dr. Lakshmi has kind of pointed us to? And how do you square it with the data and what do you see moving forward?
You can finalize. I can sign.
Dr. Lakshmi, if you can mute your line, please. Dr. Rajan, yes.
Hi. Thank you very much, Robbie. I must first tell you that you've given us a new way of looking at it. I really like the way you put the triad, and I'm sure many of us will take it forward. It's a good way to look at it. Yeah, coming to the point that what Dr. Lakshmi has said. See, we know that we have a major problem, and the recent data again shows at an aggregate level things are not improving very much. But what I might take from what Lakshmi has said is that these aggregate figures hide more than what they really reveal. We need to look deeper. We need to see where the problem is, who are the section of people who seem to have greater proportion of this problem. So because there is a wide variation, there is, the vulnerability is on many counts, the dominant one being socioeconomic. There are also geographic vulnerabilities. There are also certain social exclusions, unfortunately, that continue to be prevalent. So the vulnerability is what would really make it worse for certain section of people. So this one size fit all, those who need it most are the ones probably are left behind. I would just take that as that's the message I take from what Lakshmi has said. So therefore, my recommendation based on that would be, we need to identify pockets with serious problems. We need to identify vulnerable population in vulnerable geographies and target interventions to them. Only then we can make a far more rapid reduction in malnutrition in general. And then the question on anemia, we can take it later maybe. Thanks.
Right. So you're saying, sir, that we need to, one size does not fit all. We'll have to understand the vulnerabilities more specifically, look at how these pockets are, and then devise our interventions in such a way that it makes the biggest difference for them, rather than having a lowest common denominator approach, which may help a specific number of people, but may not address the problems where they are the most acute. If that's a way that I would kind of paraphrase that.
Absolutely. You see, at the current maturity of the programs, you see, when India started with universal programs and trying to reach everyone, the problem was far more. Even though we grapple with the very severe levels of malnutrition, they've come down dramatically in the last 30 years, though they're still very, very high, not in any way defending that. At that stage, that kind of a program to reach everyone was welcome. Now at this rate, we need to really make some course corrections. As we continue with universal programs, greater targeting would help. It's not either or, we need both.
And so if I were to kind of translate it into numbers, if we had, say, given 750 districts, we may have the equivalent of about, say, 200 districts where the problem might be more acute, and these 200 are not geographically concentrated, they are distributed around. And even within those, it would be probably 1 or 2 talukas that are widely distributed again. And so therefore, understanding where the problem is really matters. And this is where, I mean, from an earlier conversation that we were having, understanding the geographical or geospatial distribution of malnutrition becomes critical. And the geospatial distribution also will tell us the cultural or other barriers that might be actually there accentuating vulnerabilities, which is where I turn to Ankita Marwa. Mothers know when their children are not doing well. Okay, long before anybody else can kind of tell that the child is losing weight or things like that, mothers have a sense. They also have a sense of about themselves. We all have a sense of ourselves also, that we are probably not doing well, especially when our intake is lesser than optimal. It does not matter whether you're kind of not skipping a meal. The fact that your plate size itself became smaller is evident to you. Where do you see individuals? We have been talking at the big district level, state level, country level. Where do you see the individual level actions changing this story? Is there a scope? If there is a scope, how?
Sure. So first of all, thank you, Dr. Bobby John, for having me here. And I would say it couldn't have been a better afternoon, a pleasant one than, sharing the panel with Dr. Shankar and Dr. Lakshmiya. So I would say that it's a very interesting aspect which you have brought up. I believe, they say that, any change starts from self. And of course, every individual today nutrition is all about, I think, self-management. And while we are talking about increase in awareness, raising that awareness, but how much it is really translating into individual action is something. If I just give you, a broad example of what we have been doing now, if we take specifically iron deficiency. So we did an intervention and we reached around to 1 lakh school children. And what we found is that the knowledge, even this basic aspect that you need to squeeze lemon to increase the iron absorption, was such an aha and wow.
for so many mothers and children as well. And when they took that, we had a control group where this information was not existing at all, and we had another group where this information was existing, but the information remained constant with everybody, right? But ultimately, the mother and child who really went and continued to take it as a habit was very different across regions, across schools. So this primarily it tells that we might talk about awareness, lack of awareness, or we might talk about government not taking action, but it ultimately boils down to how an individual really looks at nutrition and starts taking those significant actions. So that's how I will put it.
Right. Thank you. Thank you so much, Dr. Ekta. And I'll continue this conversation around and we'll come back. Pleasure to have Dr. Meera Agnihotri also join us. Ma'am, we've been talking and we've kind of gone through this trajectory of saying that nutrition is central to the notion of well-being. We also kind of have seen that when we talk about nutrition or correcting deficiencies within the nutrition space, one size does not fit all. I would like to turn to somebody who's been taking care of women, who's been addressing issues of anemia and women's health over a significantly long period of time. How do you see things change at the clinical level, at the person who's turning up and sitting in front of you, whether she is a first-time pregnancy or somebody who is closer to her menopause? How do you see people address the issue, correlate the issue of their anemia with what they've been eating? Ma'am, you're on mute. I believe while we wait for Dr. Meera to kind of come online, let me turn to Dr. Lakshmaya. Dr. Lakshmaya, I mean, how does this, if you can go back to elaborate on, if one size does not fit all, how does it kind of work? Do you think it's going to be exclusively driven by the public sector, or is there a role that you would see now for the public sector to work with the private sector? Because what's happening at the plate level is not merely determined by what is being provided by the PDS. It's also being determined by what people are spending out of pocket and personal preferences. How do you see that change? Dr. Lakshmaya? Yes, sir.
Thank you, sir. Just before I said that, because different people are suffering from different nutritional deficiencies, like three major kinds, because they require different action points and interventions level. Because one is undernutrition, another one micronutrient malnutrition, and third one is a lot of people are suffering from non-communicable diseases. So we have to address separate section wise, because then only we could bring all those people at one healthy population level. So then one first segment of population is required for, even some people are not getting even food security and nutrition security. And some section of people, the overconsumption or one or the nutrients overconsumption also leads to non-communicable diseases like HFSS foods, like high fat, sugar, salt, and those kind of problems also there. So ultimately, if you want to bring all the groups in a wellness level, so we have to work with different levels of approaches. Then only we could make them people happy and the well-being of the people. So that is my point. Another your question is, even only alone government cannot do all these things. Even it is a multi-stakeholder approach only we can do. Either it may be private sector or public sector or NGOs, and everybody in a convergence manner. So then only we can approach. And another thing also there, lot of programs are there, wellness programs also there, and elevation of poverty programs also there, and elevation of nutrition programs also there, and people are doing in silos and different sectors and different points, but there is no togetherness. So we should bring first in one togetherness, and everybody should work for in the same cause, but there is no connectivity in between, because this kind of even, you see, this kind of even webinars and other things, even I have attended in 1 month more than 20 programs, but everybody intention is same, but there is no connectivity. So if you join hands, everybody, suppose somebody is working on undernutrition only one specific area, all should combinedly work, even that will give a very good result. And whatever our goals are there, even sustainable goals, even 2035 is there, even our Ocean Abhiyan goals 2022 is there. If you want to achieve all these things, the convergence is very, very important. And even though we are speaking 20 years convergence, nothing is happening. And sometimes it may happen in the grassroots level, and sometimes it may happen in the secretary level, but in between everything is missing. So that is my I want to focus on these issues.
And that's very, very sharply said, sir. That we have been working for over 2 decades, and yet we are yet to converge on this is how we need to work together. All of us are saying that we need nutrition addressed, and yet when we go back home, we are working in our silos, and it does not work. I mean, in fact, even on a food plate, I mean, you don't eat just the cereal once and then separately you kind of take the protein, and then separately you then they all come together. I mean, as all good Indian platters will kind of show us, things come together and things should come together. But the awareness that things should come together in a balanced form, in an adequate form, seems to be less of a reality. How do you get this real nutrition awareness, Ankita Barwa? How do you get that at again, I'm going back to the individual familial level, because from there only we can kind of pull back up. And if there is a deficiency in real nutrition awareness, then we kind of address the gaps. How do you go ahead?
So I think, like I mentioned, it's more about the behavior change. So when a mom and a child are on the table, the most important aspect is that the child is seeing the mom and the family and the elders what they are doing. And you might they might hear about carbohydrates, proteins in their science books. But when they come at home and they see that they are being asked to have a lot of vegetables, but probably grandparents or father, mother, they themselves are completely not having a certain food groups. So I think role modeling, starting from that table of family itself, is a very important aspect. Second, I would say that when we talk about, it's not just about getting proteins, carbs. So nutrition is sometimes just looked at as getting X amount of things, achieving 50% RDA. And so I think it's not about those numbers. It's also about how it is achieved, because the mindfulness is so very important. When you are watching TV and eating, you don't have your mind what you're eating at all, right? But parents will be talking on the mobiles and having food, and that's how the whole family is eating today. So I think that cultural shift, and rather than just saying that if I have added the best of ingredients in the food, I've given I could
Could Dr. Agnihotri's line be muted, please? Yeah, thank you. Yes, go ahead, Ankita. Yeah, go ahead.
So I would say that again, that the view to nutrition, besides those numbers, and suddenly if the trend of immunity goes up, everybody. So we saw that during this last 8-9 months, the search on the word immunity has gone up by 500%. So when you're talking about one particular aspect, the entire world looks at only that one dimension of health, or there's one miraculous ingredient and people will think that we are having that, and nutrition is taken care of. But that's not how. So I think the other change is not just about education on nutrition, but these hows are equally important. And third, I would say is the thing which is important is that whether we are evolving with changing times, because typically as educators or typically as people, why those synergies at times don't happen, because we all might have the same objective, but our hows differ a lot. And then our hows are so different that we are very fixated, and this is how the nutrition should be achieved. If there is a dietetic community, they will say that no, you should be eating only the whole form of it, completely forgetting the practical aspect of it. If you would have, say, a working mother like me, we would want, can you give us some simple solvable things which I can apply on a day-to-day basis? So till the time we come up with simple, workable, practical hand-holding solutions with sustainable approach to it, I think the interventions won't be that effective. So that's my view.
Dr. Rajan, where do you take that from where Ankita has kind of left us?
Yeah, it's actually very well said, Ankita. I agree with most of what she said. But I also would like to build on what she said. Much as it is important, the point that she was making is a lot of nutrition has to start at individual level, at family level, at community level. Now, the facilities that the government they create access where most of what they give is generally product based. You come to me, I'll give you a vaccine, I'll give you an injection, I'll give you a medicine, I'll take care of ABC. But then the decision to practice things happen at individual level, therefore at family and community level. So if we have to build this, though we've been focusing on what we call behavior change communication, now they've added it as social behavior change communication. All that is important, but what we should really aim at is changing the societal norms for certain things. Where do a poor mother, it's not always the knowledge about a thing. They just check with their peers as to, have you vaccinated your child? What do you do after a pregnancy? And what's your breastfeeding, behavior? So it's not always, it would always help to equip them with adequate knowledge, but that alone will not suffice. We're not making enough effort to change social norms. See, when social norms change, the community as a whole would try to live up to that and change their things. And you can really, if you dig deep and look at the data, you'll find in societies certain behavior move in a herd fashion. So for nutrition, we need to just move away from this. Much as we'd like to do at individual level, equip them, we should also make a lot of effort to change the social norm. That's what I would add to what Ankita well said. And also on that you asked, yeah, right.
Right. No. So I just want to hold up because there is a fascinating nugget in the NFHS 5, which for me personally, I kind of picked up because when I started off my work career, I stayed in a village and I was kind of always fascinated by this young woman who would be brought by an older person in her family. Probably that's the only time that I would see her in those days, which is, doctor, she is pregnant, she needs that tika. When I look at the numbers right now, we are well over 90% into coverage for tetanus toxoid in antenatal populations. And that tells me, what you said just now is important. It was a single thing, of course. The messaging was very, very clear. The social side of it was taken care of. Everybody knew that a pregnancy meant a tetanus tika had to be given.
Hello.
But it was easy to administer because it was one thing. Nutrition is not just one thing. Nutrition is
Hello?
365 days, 3 times a day, and many, many more things.
Hello?
And so it becomes that much more tougher to manage. How do we build this
Hello?
social? I mean, yes, there is the individual thing, there may be the aspiration, there may be the individual level actions that are required. But how do we provide the supportive framework that allows for that translation to take place? Both first Dr. Rajan and then Dr. Lakshmaya on that.
Yeah, thanks, Bobby. I mean, I don't have the answer. You know, I think you picked the right one to say something which people weren't taking at all, tetanus toxoid, and then you see it has reached, optimum coverage. That's a good thing. So,
hello,
we need to do. It's a package. It's not that. Of course, there are a number
Rajan,
of
if you can
things
just
that
hold
have
on
to
a second.
be
If you
done.
just hold on.
Hello, am I audible?
Yes, Dr. Meera, you're audible, and I will come to you next. I will come to you next. Right. Rajan.
So, hello.
Yes, please go ahead, Dr. Rajan.
Yeah. So what happens is that it's a package. Even if we change the social things, a number of things are not happening at individual level, not necessarily for lack of knowledge or lack of willingness to do, but there are many other constraints that come. It's not just to know what is the right thing to feed a child, but you may not be able to, it's the access, affordability, a number of other things come. But still, I think we should try to move the societal norm as a whole. All those who are able to practice such a thing would automatically practice. That's a point I'm making. I don't think that's a solution, but we're making very little effort on that. We're focusing more and more on individual things. To say on the point which Lakshmi so brilliantly said, that, he said it very well, that we need to learn to work more and more together. Even within this nutrition package, there are several people. There are people who have only one size hat to sell. They will try to fit it on the head that it would fit. See, that's a problem. We need to go with the package. We need to make it available to the people, accessible to the people, and people will practice within their constraints and remove the constraints as we learn and understand.
Who better than a person from the corporate sector, especially putting out different packaging sizes, to know or comment on how to put different package sizes or different product offerings in front of people, so that both individual behavior is achieved, and also that there is a wide variety of choice available, or specifically available for different target groups. Welcome, Dr. Bhavna Sharma, to the conversation. This has been going on for a little bit, and we've been talking about how to make nutrition both available to those that need it the most. Dr. Lakshmi has very succinctly put it, one size does not fit all. And the last comment that you heard from Dr. Shankar was, you may have to package it differently. And that's why when I saw your screen pop up, it was very easy for me to kind of flip to you. Because from your world, in the corporate sector, you know the science of packaging and the science of targeting. How do we address the pockets of undernourishment or malnutrition in the country right now? And then we'll kind of then flip to the other side, which Dr. Lakshmi has earlier on pointed. It's not just undernutrition; we are also seeing the other side of it too, the overtake or the over nutrition side of it. But let's take the targeting of undernutrition, please.
Yeah, thank you. First of all, apologies for coming in a bit late. But I think, I think I did join it at a very interesting point where you guys are discussing about this whole packaging. And I think, as you rightly said, we have that saying, you don't actually eat the food when you actually eat it. You actually eat it the moment you see it. You actually make your choices much before you're actually even holding a piece of, a sweet, or, even roti, or anything it's been made at home, or anything that you see it on the shelves. You actually see it first and then decide whether you want to buy it or not. So I think when you say there are two aspects of it. One is the entire packaging, which is the whole communication, the colors and the schemes and the way it is written, what you choose to highlight or what an FBO chooses to highlight on it, and I think I always state this example, because we're talking about both under and over nutrition at the same time. And I'm talking about, the time when, I think when this whole HFSS and, front of pack labeling and all those discussions were coming in, where we have to put in calories and energies and all those things. I remember being part of some of the discussions with the current in their homes, where actually how they flip their decision making on buying something. So if you actually say on like a carton of milk, plain milk, and if you just put it out to say that, it is low calorie milk, and she said, yeah, actually what, I would like to buy that. Thank you for making it for me, because I think I can manage my life better and things like that. You just flip it and you say it's low energy. It's the same unit, right? She said, how can you even think of making, milk which is low energy? How can you even think about all those things? It starts from the fact, which is the communication, the claims, the whole packaging. It also goes to the fact, like you were talking about. Yeah, I think someone.
Go ahead.
So basically what happens, when we talk about, packaging or the pack sizes, the universes are actually very, very different and apart from both under and over nutrition perspective. So when you're talking about, if I would like to probably assume that, in the world of the whole over nutrition perspective of it, the pack sizes, the communication, the claims which are written there are actually, people like to believe that they read it, but a lot of them don't even understand what's actually written on that. Even today, if you talk about it, people don't know the difference between, sometimes fiber, prebiotic fiber and a probiotic fiber, and what is going to be a TDF. Explanations, as they start to happen, they start making a big change. When you talk about nutrition, I think that's a whole new different world, because there, I think a lot of people are not even at the scale of, even being able to read what's written on the pack. I think they're just going by the visual, or they're going by the, like the national, like a samachar that goes, or it's part of some campaign which is led. You have to actually explain the benefit. And actually, I'll tell you one thing, when you talk about those communication, it has to be one communication, a pack that is usable, a pack that is smaller, a pack that is, somebody is affordable. So we always talk about this fact. There's accessibility, there's affordability. In that, we have to manage the nutrition credentials of a product. So I think, it will be completely unfair on my part to say that, these two things can be solved together in one sentences, because the kind of people, the kind of communication, even the pack sizes, like you were saying, because the cost and the purchase, because we always do the cost versus value, equation in our heads, they have to be tackled very, very differently from each other, so that when it was made, the intent for which it was made, the target group it was made for, it should reach them in the right way. And the language, like I said, even the visuals, the colors, what's written on it, how it's communicated, is it part of a national intervention program? And I think foremost is that any intervention program that we do should not take people away from buying something extra, buying something expensive, introducing a new food habit, and making them do something which is out of their ritual, because then that's never going to get accepted, no matter what you do on the outside. So I think there are some fundamentals in place that have to be put together. And I think, sometimes I say that, when I work, it's so far easier for me to make a research project and, do a CSR intervention or a sustainability initiative and knowledge. The moment you introduce a product education intervention model into it, it completely takes to a very complex dynamics, because you want the benefit to reach, but to do knowledge plus product together for the right benefit for the right target group is actually very difficult. And I think we have to do it, very thoroughly from step one. I hope I've been able to give on to that part.
Sure. You're just kind of bringing it to very, very sharp relief. On my screen, I have Ankita Marwa and Bhavna Sharma on one side, and I have Rajan Shankar and Avala Lakshmaya on the other side. Literally, I've got two sets. And it's almost like there are two different vocabularies right now that, as Dr. Lakshmaya kind of right in the beginning said, we need to figure out how to bring together, to converge. There's the specificity, there is the targetedness, there is the almost, how should I say, packaging that seems to be missing, or that seems to be less evident in how we are approaching the National Nutrition Mission or the Portion Abhiyan, or how we kind of engaging with the small groups, which are large in the aggregate, but are small enough that they are lost in the larger context. How we get to them? How can the two sides work together? Dr. Lakshmaya, I mean, you've made the plea that 20 years we've been talking convergence, we have not kind of worked together. How is it going to work together?
Sure. I already said that because the convergence is there. Convergence is at grassroots level. Suppose ANM is there, then Anganwadi worker is there, ASHA workers are, they are working with convergence. But at a secretary level also, there is a convergence. Secretary and additional secretary, some high level. So, but there is no in middle level there is no convergence, because until the middle level convergence is achieved, then only we can that percolate into action. Actually, that is not happening.
Would you
And
give an example of what the middle level convergence would look like?
Middle level means are direct program managers. Suppose just example, one or two things, some ICDS if you take, ICDS and health and social welfare. Okay, so I am working since more than 20 years in ICDS, MDM and other nutritional programs. But what we found, there is a gap, lot of gap in those between is, there is a grassroots level. Anganwadi worker is working, helpers are there, then ASHA workers are there, then village volunteers also working together. But at the same time, there is no convergence between medical officer and CDPO and DPO. I'm taking just one example. It may be in several sectors also this is happening. So until unless if the immediate managers, the program managers and our program implementers, if there is no convergence, because nutrition, as you know, it is a multi-sector approach only we can achieve, because one department and one individual cannot do anything for improvement in nutrition, because nutrition depends in several factors. So either it may be production, agriculture, or health service, healthcare, or it may be social welfare, or it may be education. So several sectors involved, because until unless if all these, we also categorize into three things. One is a primary stakeholder, then is another one is a secondary stakeholders. So primary stakeholders, at least 6 departments identified by the government of India, and from nutrition National Institute of Nutrition also we recommended these are the primary stakeholders should together work. Otherwise, until unless if togetherness is not there, we cannot achieve the common goal. So that is my point. And another point also discussed is several experts, like even at individual level within family also the distribution is not equal, because we have published 2-3 papers on intra-family distribution of energy, protein and other things. There is a lot of gap, because if you take overall at a household level, enough calories are coming from whatever food they are consuming, but the calories distribution is not equal. And you will be surprised, because 2 adults are there, 2 children are there. We have specially analyzed in children food what is the intake of their energy, protein and other things. And surprisingly, we found even poorest of poor families, we found that the adults are getting adequate energy and protein, but at the same time the children are not getting adequate protein and energy. Why it is happening? Not because they are grabbing from children and eating adults, but it is a ignorance. There is no nutrition literacy. Even we people say that you increase the literacy, automatically nutrition literacy will not increase, because nutrition illiterate, even illiterate people also nutritionally illiterate. So we have to improve. Education is very important, and we have to convince and promote this equal in the equal distribution of food and adequate balanced diet. And recently we published one book, What India Eat. So in that book, we have mentioned all what regional wise, in individual wise, what is the difference. And we have also developed my plate. So what the ideal plate should be. As you correctly said that our plate is reducing or other thing. But we have this, my plate is a very good example as a balanced diet. And we have compared with my plate recommended diet and what is actual intake. There is a lot of gap. There is some excess nutrients also there. There is a less nutrients also there. That should be balanced. So then only it will be happen as you aspire that well-being.
Right. Thank you, sir. I mean, because Dr. Lakshmi, you've kind of so clearly kind of spoken about the places where the convergences need to happen. But a lot of the convergences that you are speaking about are still within the government or the public sector. The plate is not entirely filled by the government sector. The plate is filled by offerings both from the public and out-of-pocket private expenditure too, right? To greater or lesser extent. How does that convergence happen, and how do you kind of leverage the capabilities of targeting or the capabilities of packaging so that the plate, as you so eloquently puts it, and I'll come back to that because it's a great picture, how does that get addressed? Dr. Rajan, how do you kind of bridge that?
Thanks, Bobby. I think that's a very important question. The first, we should realize people don't look at government for food needs. You know, if you take, and we're also rapidly urbanizing, more women are in workforce, and we're no more a subsistence agrarian economy. More people are getting into cash economy. All this means people are looking to the markets for their food needs, and more will look. And we're also rapidly urbanizing. We tend to say, when we think market, we tend to equate it with big, multinational companies and packaged food. I think that's the first thing we should take out. They are part of a much bigger market ecosystem. And in countries like India, they're actually a very small part. You know, they may drive changes in terms of food safety and how it should be packaged and what is good for a lot of our things. See, who trades with food? There are only 3 states in the country that do not import wheat. There are only 3 states that do not import rice. There are only 3 states that do not import, edible salt. So there are lots of the private sector that moves and makes food available. So there's no question that they play an important role in filling our plate. So there's no question. So let's not put it only to the packaged big multinational. Now, when it comes to that, I think very unfortunately, this tri-sector partnership of getting government, private sector, civil society, much as we know that it is required, it also comes with a lot of difficulty. I personally had many disappointing experiences in the past. It doesn't seem to be working, but it has to work, and that's the only way solutions will be found. One of the most recent attempts is in India, the UNICEF, the Tata Trust, they have come together with some, NGO CSR box and trying to create what is called Impact for Nutrition. We brought more than 100 private sector partners to come together and just do what the National Nutrition Mission has asked the private sector to do. It's not about the product. It's about, what they can really bring. And I think all the sectors they have deep suspicion of each other. The private sector thinks that the government is inefficient. The private government officials think that the private sector is only for profit. I think gone are the days. Everyone is looking at a sustainable way of doing business, sustainable way of, improving the welfare of, things have gone. Everyone, the people in your panel come from background where they're looking at triple bottom line. So I think we should somehow breach these, artificial bridges, bring everybody together to work, and only then we will be able to reach the benefits of science as well as, what private sector can bring, and, reach it to those whom I said initially need to be targeted. We can't leave the most vulnerable to the government and just leave, the private sector to take care of those who may not really require all that advice.
Right, and that's wisdom, and that is experience for us who are listening on the audience side. The elusive goal of getting the 3 sectors to work together, the necessity for making sure that in some way or the other it happens, but also recognizing that it is not the exclusive domain of one or the other to fill the plate. At the end of the day, the plate is financed by the individual who's in front of whom it is, because they pay both their taxes, even if they are not directly paying it, and they're also paying it out of pocket. So really speaking, the plate really is being paid for by the person. It's not being paid for by somebody else. And in many ways, figuring out how to make sure that it is wholesome, that it is affordable, and that it is readily accessible all throughout, and with no disparity within the family, as Dr. Lakshmaya kind of pointed out, that the adults get an adequate proportion of it, and the children get left out simply because they don't have adequate information. And this is where I turn to Ankita Marwa. Conversations around information at the family level, and also the zeitgeist of what being healthy means, or what eating healthy means. What are the millennials thinking, or because we are seeing malnutrition among them too, both on the undernutrition side, the number of children that are teenagers that are showing up with lower calcium iron levels, or also on the overnutrition side with body mass indices really not where they should be. What is happening there?
So I would say for millennials, what we have observed is the definition of nutrition to them is all about weight management. It's about extremes of nutrition, extreme of exercise, extreme of a quick fix. Everything needs to be quick fix and achieved now and here. Again, that broader concept of nutrition is missing. It's not about nourishment of the feel of aha or the feel of I'm great, but the nourishment of real body, mind, soul, which you were talking about some time back. So that nourishment concept, the nutrition concept, needs to be understood more holistically by the millennial population. We would say that literacy, we did one research, and cereal being an integral part of our diet, we thought that because and that too millennial population in metros with an SSEA kind of consumers. When we went to them, 1,000 of them, only 20 of them knew what whole grains were. And some of them, they said that even white rice is whole grain, a significant proportion of them. So they were eating white rice considering that's whole grain. The concept was this looks whole, so that's whole. So how it was viewed was so beautifully different, and even simple things like this made us realize that it needs a lot of education. No matter how much claims you will put that this has so much of whole grains and XYZ, but every person is understanding with their own way of looking at it. And suddenly we are seeing so much dialogue on intermittent fasting and the fat diets. So I think you will. Yeah, so I think probably the holistic nutrition is something which this millennial population definitely can achieve through their knowledge and being so digitally savvy. And as I would say for this population specifically, like I mentioned, instead of quick fix, how can we evolve them into a more sustained living concept is something which will be very critical.
Thanks. Dr. Meera, you've seen women, say, 3 decades ago. You're seeing people who turn up into clinics today too. What's different in their concepts about nutrition, good food, say a few decades ago to today? Do you see any changes? And do you see changes in the people themselves? I mean, in terms of the nutritional status of women that were coming into clinics, say 3 decades ago to today? Ma'am, you're on mute. If you can just unmute. Yeah. That's fine. Your person can help you. Yes.
Hello.
Yes, ma'am. We can hear you. Go ahead.
As far as I understand your question, you wanted to tell me about the nutritional status of girls and women 3 decades back, and
now, what is the change that you've seen? What is the change that you're seeing now?
That's a lovely question, and a rather more important question to be put before patients, before teachers, before practitioners. and also before the politicians, and also those persons who are charging and making diet and nutritional protocols, guidelines, and so not and so on. So it's not a question for me, it's a question for all to solve. The most important thing which I like to tell you, 3 decades back, our girls were not that empowered. And empowerment is one thing which is very important, as we keep on telling them, swasth, shiksha, swavalamban, samajik ekta, samvedana. These are the things which were not there in our society earlier. What we used to learn that, unlike what was told by earlier speakers, I was not present earlier, much before. So only thing which I used to notice that when the food is there, suppose there are 4 chapatis, it will be given first of all to the head of the family. It will be given first of all to the boys. It will be given first of all to the, you see, those who are earning members. And women and the ladies and the girls were the last person to get it. They will not bother whether these women are healthy, they are anemic, their iron level is low. I believe that we received patients even at 4 grams, gasping, panting, and asking for help during pregnancy. And they have prepared food before they come to the hospital. Then attendants will be telling whether she was all right, she has prepared food, she has attended the kitchen, and now she is lying. Will you believe it? A girl or a lady with 4 and 5 gram hemoglobin must be preparing food for the family and has not taken anything and is coming to the hospital. So these were the things which we were observing earlier in a bigger proportion. And the level of the anemia, 3, 4, 5, incompatible anemias, we are exchange transfusions are needed. They are extending up. It's not that. But unfortunately or fortunately, in our country, the level of the anemia, in spite of our fight, right and left, from every level, right from Anganwadi to so many other things, and so many rules and regulations framed by our Honorable Prime Minister and government, we are not able to come out of the crisis of the anemia. And if it was 50%, 2 out of 1 girl is anemic, 2 out of 1 girl is, maybe that a decimal change is there this way or that way. But we have not come up with a substantial improvement in the treatment strategies. So earlier, we were fighting for anemia. When I was a student, when I was a lecturer, when I was a reader, all through, and today, when we are dealing with all these things, we are fighting with anemia, anemia, and anemia. One thing which is very important to tell, to convey, it is not only hemoglobin, it is not only iron which with we are fighting, it is not one element. We have to look for the holistic approach. We must convey what we were telling our girls, iron ki goli dena or folic acid ki goli dena, and that asha worker and seva workers and all these are ki 100 goli deni hai sarkar ki. We have to tell them they are having hypovolemic anemia, they are having hypoproteinemia, and the children which they are producing, they are so deprived of it. Intrauterine growth restriction, intrauterine growth retardation, mental deformities, congenital deformities, they are rising like anything. So past and present, if I compare, anemia level was always there. A little decimal change from this way to that way there. We have not conquered it in spite of so many efforts by the government and the private sector and the hospitals which we are running. So we have to look for it. We have to go for the holistic approach. And this holistic approach, we have to tell this is the palm, you have to divide it 4. We have to know what are the micronutrients, we must know what are the macronutrients, what are the essential nutrients. And we have to tell our patients what is the difference between nutrition, malnutrition, undernutrition, and overnutrition. Because a different class of the societies, you see, the babies are coming to us, they are full chubby and getting everything, and then the chocolates are being kept inside the mouth of these girls. So they are chubby, they are having PCOS, they are having diabetes since beginning. So holistic approach for nutrition must be there. I'm happy to inform you that in the medical colleges, we are working very hard on the ethics and research centers in collaboration with the IITs, and we are preparing and telling our patients with a chart over there that it is not iron alone which will work, you have to take protein also, you have to take calcium also. Why calcium? Why iron? Why this thing? So now they are understanding, and we are having these Garb Sanskar classes also for our patients so that they may have what we really want. So a holistic approach is required, and a typical guideline in Hindi and any language, regional language is required for the patients. ऐसा नहीं है कि उनको थर्ड ट्राइमेस्टर में है. They have to be told before pregnancy, during pregnancy, first trimester, second trimester, third trimester, and thereafter when they are lactating. It's not a blanket statement कि आपको 2 रोटी ही खाने हैं. We have to tell why you have to take more when you are lactating. We have to tell why you have to take this thing in the first trimester. These are the things should not be taken. That is what. So these are the changes which I personally feel they must be put forward categorically, telling that these are the guidelines for this period, these are the guidelines like this, and these guidelines we are putting into the antenatal box. Going to the schools, adolescent health has to be told to them. And there are different guidelines for the adolescent health, right from menarche, early adolescence, late adolescence, and so on. So this is my point, sir.
Right. No, please. Meeraji, thank you so much. I mean, there are 2 things that I want to kind of hold out to the audience. I mean, that I captured. She said 5 words. 5 sakar. Swasthya, Shiksha, Samaj, Swavalamban, Samajikta. Correct, madam?
Yeah, they are the one.
Correct.
These are the important things we have to catch up.
These are the 5 things that she said. And then I want us to kind of pay attention to each of those words because they mean something in the context of our communities.
Right.
They mean something for us as individuals and how we kind of go forward in holding and bringing up the nutritional levels. The way she kind of pointed out, and I have personal experience, I have delivered a woman of her 5th baby at 4 gram %.
Right.
I had seen her only when she came in for her delivery. I did see her once again for her 6th baby. She almost died. Right? And that was only 25 years ago.
Right.
We haven't moved that much. The second point that she's making is absolutely important. It is, yes, iron and folic acid are important, but not to the exclusion of the overall protein intake. If you do not have between 0.8 grams to 1 gram of protein per kg body weight, and I've done a rough math on this, by 2050, if we are assumed that we have 1.5 billion people in India alone, we'd be requiring close to 30 million tons of purified protein per annum. How on earth are we going to deliver that? Because that's purified protein available. How on earth are we going to deliver to the point that Dr. Meera Agnihotri has just pointed out? Not merely hemoglobin, but the overall availability of protein so that the body is better nourished.
Right.
So that the body is better strengthened. And that will require, again, to go back to what Dr. Lakshmi had started off with, it has to be a multi-sectoral approach. It cannot be one or the other. You will have to have an agricultural signal that prioritizes protein outputs. How do we do that? Are there private sector mechanisms? And I know that Dr. Sharma's organization has got these chowpals that are now being established across the country. We need to figure out models like that allows for farmers and our primary producers to produce a variety of things. We prioritize cereals because we wanted calories. We've got a surfeit of them. And we've got the problems of over-calorie intake in a large proportion of our population too. How do we correct that balance? How do we ensure that there is adequate protein? Because if we don't have adequate protein, even as early as the first trimester, by the 8th week of gestation, we will begin to see impact intrauterine for cognitive development.
Right.
And those are things that we cannot really correct for outside of the uterus. It has to start a long time before. And in doing so, a simple question that I've been asking that I have not had an answer to is, do we know the average birth weight of a baby by district? That should not be a hard number to ask. It will tell us exactly what the mother has been eating, what the family has been eating, what's available in the community. A birth certificate is a legal document today, and so the recording of a birth weight is also happening. Why is that number not available on a real-time basis, which would allow us to go back to an earlier point with Dr. Rajashankar was saying, of the 750 districts, it may be only 200 districts, which may be spread across 35 states. And in the 200 districts, there may be only about 2 talukas each that may be kind of actually dragging everything down. If we knew where the birth rates were low, wouldn't it be a sensitive, albeit a tragically late indicator to tell us where to focus our efforts? Would that be the place where we would get a better targeted marketing, packaging, communications, and generally nudging the mothers and the community to better frame their plate? Dr. Lakshmaya, how do you want to kind of take that conversation into the convergence that you have been so eloquently crying for?
Sorry, I missed it, sir. Which point?
So I'm just saying, how do you kind of take that convergence into seeing actions on the ground in the places where they're most needed, in the places where Dr. Meera is describing that women are still coming in with very low, with anemic profiles?
Sir, in several forums, we discussed about because some program monitors or program implementers are there. They are implementing the program. But the monitoring, close monitoring, supervision, concurrent supervision is nobody is doing. So because we, from the beginning, we are recommending the government and all development sectors that there should be some independent monitoring and evaluation system some vertical system should be there. So then only, because now apna baby wo sundar lagta hai. So if same department is implementing, same department is monitoring, everything seems to be good, and it is just like a good well approach. Not like that, because if I am implementing the program, somebody should external body should come and inspect periodically whether this whatever inputs are going or not, whether what is the gaps are there in this program, how to rectify this program. So that kind of some independent monitoring and evaluation should be there. Then only the convergence and those things will be happen. So if you talk about convergence, another 20 years also it will not happen, because until
Dr. Bhavna, how do you see this convergence happening?
Wow, it's see, I think it's a tough one. It's most required, but I think what Dr. Lakshmaya just said, I completely second it. See, I think we all have been trying our best to work together on these things. We also know they are extremely important. And I probably would probably say from the size that we have been working from, I have also seen this kind of programs and, kind of a dependence on each other to actually take those things ahead. Initially, there used to be a lot of, pressure for, organizations spending that 2% about doing some kind of a good thing. Do a CSR, okay, do a CSV, encourage, adopt, educate, and just sometimes you do it with all your heart and sometimes you're not doing with all your heart. And then I think over a period of time, with this whole nutrition, public health information, with the data sets now becoming available for us, like you just said, I think a lot of people don't realize exactly what you just said, that important, critical, missing data set, right? Like my own PhD, I had done it for vitamin D and calcium status for the Indian pregnant women and its impact on the neonate at 40 weeks. And, I collected the cord blood and I collected the, blood at 40 weeks and things like that. And I actually realized that, by the time I'm taking the data for the infant at 40 days, sorry, not weeks, 40 days, it's too late already. It had to be done much before the woman was even thinking of conceiving, and things like that. And why was it not told? And this was, picking up women from the lowest strata, because they are the ones who are actually, bearing the brunt of the whole thing. From the public health coming onto then I realized that, there is a whole new word of brand sustainability initiatives that have come, and each organization have picked up their own SDG goals and stuff like that. Today, I think from whatever little experience I have gathered in the last 15, 20 years of my work, today I see from where I come from is that brand or the organization sustainability goals are somewhere directly or indirectly linked to these kind of things, which are solving two things at the same time. They're also bringing about a lot of communication, a lot of transparent information sharing, within an organization to get, aligned on these things which are happening outside, and they know they cannot survive without it, because you have to work towards your country, your countrymen, and the planet and the community as a whole. And it also helps the cause on the other side. And the various people who would not even probably have thought of nutrition or health and these kind of words are actually talking and discussing in the boardroom and saying, how do we make it better? Because our organization is now linked to it. So, like I said, it's going to happen differently when you're sitting in a boardroom versus when you're going to be sitting, in a government office. But I think what Rajan sir said some time back, it has to happen. Some people are a little ahead on this journey. Some people are getting onto that thing, but it has to happen. And if it doesn't happen, I think we all were eagerly waiting for the NFHS 5 data to come in, thinking we were going to get a little smile on our face in this terrible year of 2020. But unfortunately, it didn't happen. Today we are talking about, anemias in the children and the obesity in the, thing. They're still going from bad to worse. So I think there is something seriously missing in the work we're doing. And we seriously need to take this ahead to make it a lot better than what we've seen this year.
Ankita Marva.
So I would say that again, we want the conversions. We all have that intent, and we are seeing. I would say that I have seen some very unique programs which were not happening in India earlier. I would talk about if you look at UK, there were salt reduction program where the government had the same campaign. The consumer organizations were talking about the same. So the pitch was same, and even the companies were having the same pitch. Versus, I would say probably if an IIM is saying my plate, I go and as an organization talk about it in a different way. So when we have the broad messages like most of us spoke about, if we know that we have a common theme and our articulation and language remains the same, and so that's one way probably we can align. The FSSAI came up with a lot of programs, the Eat Right. So that's a mission. So again, there is a whole call to action being given with that whole nomenclature and bringing all the groups together. At least that dialogue has started. So we have definitely seen those actions emerging which were not happening earlier. So I would say that gradually we are moving into that direction. This panel itself, thanks to you, we are openly talking and discussing about these aspects today. That again shows the progress we are making. But 2-3 tangible actions probably at a broader level with this kind of a panel approach from various sectors where everybody signs to a common theme plus 2 clear actions and say how each one of them can contribute in their own ways could be very meaningful. Those could be few conversion points from my end.
Now, those are helpful for us to take on. Meeraji, what is your recommendation? How do we move forward?
I personally feel that we all are fully aware of what we should do. The only thing is how to do it. Everybody is knowing that this is done. I've heard Dr. Sharma talking about the vitamin D. It is one of the very important research which was given to our student. And the anemia, so-called anemia. Vitamin D is one of the deadly duo to transform iron. She will be agreeing to me if she has done this research, to transform iron at the bone marrow level much before it is needed to convert it into proper erythropoiesis. So these things are coming up. I'm very happy that she has put it. This deadly duo must be known. What I want to tell, I know, and everybody is knowing that this should be done, this should be done. We have already framed guidelines, and these guidelines in any language, wherever it is used, must be given to the lowest person in the simplest language to be translated and transformed to the patient. If I say, tum 2 roti khana, the other Asha worker goes, nahi, tum ek hi roti kha lena. So there must be a guideline ki this is the plate or this is the proper this thing, 1/4 must be this must be the amount of the protein. Or protein zaruri nahi ki bazar se biscuits aap le aaye, that is the protein which is needed. Should not be. हमारी जो लेडीज हैं दे आर नॉट वेरी रिच. अगर हम उनको गुड़ आयरन के लिए चना देने के लिए if we recommend it, that is one of the best thing which we can advise. Suppose I am a poor person, you advise me charcoferol, you advise me iron tablet or 20, I will never be able, I will throw this prescription into the waste paper basket. whether whosoever is the obstetrician or gynecologist, I will not be able to buy it. But if you very clearly tell me that, madam, you can take this thing in the morning, आपके घर में ज्वार हो रहा है, बाजरा हो रहा है, और तुम्हारे यहाँ किसकी खेती होती है, then they can jolly well translate. So we must know what we are prescribing, how we are prescribing, whom we are prescribing, and at what stage we are prescribing. And these guidelines must be kept on our table. We are doing it in our medical colleges. These guidelines for adolescent girl. Adolescent girl में menarche में उसको क्या देना है, different. Early adolescent में क्या देना is different. Late adolescent में देना है क्या different, because the hormonal changes are there. So we only know. And if these things are told in a very simple language to the, even our Aya, she will be able to tell, yes, जैसे डॉक्टर शर्मा ने बताया कि नहीं ये गोली भी जरूरी है लेने के लिए, और जरूरी नहीं कि सब चीज गोली से हो, आपके घर में ये सामान है, you can take this thing, you can this thing. One of the doctors, Doctor, I can tell you, in our college, he has made a laddu for poor patients. Basket भर के वो ले जाते हैं, उसमें मुझे I don't know the contents as well. For the adolescent girls, जो स्कूल में पढ़ने वाले बच्चे हैं, उसमें चना मिक्स करा है, उन्होंने गुड़ मिक्स करा है, so many other things. And it's a very simple thing. जो घर से एक रोटी भी नहीं ला सकता है बच्चा, उसको अगर हम ये दे दें. If we are talking for very high class, it is a different prescription. If we are talking to middle class, it's a different prescription. And if we are giving it to those, we must know whom we are giving, whether they are utilizing our prescription or not. So that is the most important thing. And these guidelines must be framed. हमको मालूम है कि हम मूली खा के भी ये काम कल चला सकते हैं, गाजर खा के भी चला सकते हैं, चुकंदर खा के भी चला सकते हैं, और बड़ा सा that huge 10 रुपए की एक गोली से भी चला सकते हैं. तो we must know whether this गोली is to be utilized or not. आपने एक पैकेट गोली दे भी दी तो वो कितने दिन चलेगी उसकी. तो we must convey in a simple language what is nutrition, what is malnutrition, what is undernutrition. हमारे माँ जो है वो complete circle है, उसको nurture भी करना है, उसको absorb भी करना है, उसको बड़ा भी करना है, उसको lactate भी करना है, उसको feed भी करना है. So we have to tell it in that simple way to our mothers, and these guidelines must be kept before everybody. उस guideline को किस language में किस तरह से transform करना है, ये हम लोगों की duty है, those who are connected with the patient one to one. This is what I feel, sir.
Meeraji, thank you so much for capturing many of the things that had been spoken, which brings me back full circle to Dr. Rajan Sankar, which is that one size does not fit all. There are vulnerabilities and exclusions that are different in different places. And so therefore, like Meeraji so eloquently put it, the same prescription does not work everywhere.
Very true.
It will be different. It will be differentiated approaches. And it will have to be tailored to the need in front. Seems to be a tall ask in a very large country. We are 1/5 of humanity. Proportionately, we also carry the largest or over-representation of the nutritional underperformance. What do you see the 2020s holding for us in our trajectory towards addressing malnutrition and detrimental nutrition in our country?
Thanks, Ravi. I think, it's been very instructive listening to the people. And I would just touch on one that repeatedly came up as, say, the convergence. What we mean is that, this problem that we're talking about is multidimensional. There are many causes, many of them interrelated. Therefore, the solutions also have to come from different sectors. After all, we've created the sectors and silos only to improve performance of each sector. So it's very difficult to breach them. They function very well. What is needed, it's based on an evaluation by Professor James Levinson of some of the successful multi-sectoral programs. He clearly said, we must bring sectors to sit together, plan together, work on an agreed framework, go back, implement sectorally, come back, take stock multi-sectorally. Then, that's what we have to somehow understand. On the question of what we have for 2021, I think even this recently released NFHS 5, there are lots of successes that we see. There are very, many bright spots. The children are living longer. The more girls are in school, more girls are staying in school. The age of marriage is going up. The age of first childbirth is, moving up. The BMI of women as a whole in the country is going up. Of course, at one extreme it's going, but and the low birth weights, which you referred to, is coming down. The water and sanitation has improved tremendously. The food availability is there, but it's only a question of creating that access through policy instruments. So let us not get fixated with just one anthropometric indices of saying they're important. I'm not trying to wash that under the carpet, but there is a lot of good things that are happening. Maybe we need to persist, we need to target, and we will see a quick jump. This is a country which, as a medical student, I had seen children coming with, the eyeball coming out. I mean, that kind of keratomalacia, you would know, and, Professor Meera would agree with me. We've just all that is past. Though we have that anemia level not moving at aggregate level, like what Madam brilliantly said was, she doesn't see so many women coming with 4 and 5 grams. Within the anemia, people have moved from severe to moderate, moderate to mild. So, there is a lot to celebrate. We should learn to celebrate our success, but at the same time, ask for more. And I think we have the fantastic infrastructure in terms of health and ICDS. We don't need new intervention. We should correct the implementation failure. We should change the seeking behavior of our population to go and seek and utilize and own these centers. And I think with this infrastructure, with the right programs, with change in the thing, and all the sectors playing their role, that breach has also happened. We're looking more at a tri-sector partnership of government, business, private sector, the civil society. I think we are in for good time. We will see very rapid reduction in time to come.
Thank you.
Dr. Shankar, thank you so much. Thank you each for sharing candidly and from your wide variety of experiences. It's also sometimes a privilege for me to look at people's backdrops. One of them in this panel says there's no substitute for hard work. I mean, that's you, Dr. Sharma. Yes, there's no substitute for hard work. It just tells us that despite all that we have done, we still have a bunch of work ahead of us. And each of us can be champions of change. We have to work together. That's Dr. Rajan Shankar's backdrop. In our spaces, from our spaces, we'll have to respond to the challenge and the call that Dr. Lakshmaya had placed several times over. You cannot work in silos. We'll have to bring convergence together. Multiple sectors will have to work within the government, across sectors, the tri-sectoral partnerships that Dr. Rajan Shankar has pointed us to. When we do that, we will begin to change some of the mindsets that people will have, whether it's the mother in the village or whether it's the millennial who's got a little bit of cash in her pocket. What do they choose to spend it on? Will they understand that it's readily available things or easier available and yet affordable things that make the most difference, vis-a-vis something that might be on trend but does not really add value to them? We also need to figure out how we communicate not only to ourselves at a community level. Again, I go back to that 5 S's that Meeraji pointed us to. We'll have to understand that swasth is important. Swasth can be sustained with shiksha, particularly among the girls and women. Gives rise to samaj, gives rise to swavlamban, and we need to have that samajikta around so that nobody drops out.
Very true.
If there's somebody going hungry, or if there is evidence of a child or a mother not doing too well, then it's humanity that we hold them together. The social safety nets are there from the government side. That needs to be supplemented by good neighborliness and convergence. of many intentions, so that we will not have another round of conversations looking at yet more dismal numbers on either anemia or on malnutrition and malnourished babies and stunting, which really eats away our demographic dividend. It's been a privilege to have this rich conversation with each of you, Dr. Rajan, Ankita Marwa, Dr. Bhavna Sharma, Dr. Meera Agnihotri, Dr. Lakshmaya. Thank you for your time. For those of you that joined us in this last hour's worth of conversation, I hope you've had food for thought, and more than thinking, you will act. Thank you for joining us at IHW. Kamal Narayan, over to you.
Thank you so much, Bobby. Again, another very, very insightful and empowering discussion, I would say. And I would like to take away the message from this particular session is the message of hope and I think positivity, which Dr. Sankar highlighted, that there has been a lot of improvement. There is a lot to be done, but at the same time, I think we are getting many such those good signals, and COVID, despite it created or wreaked havoc in all our lives, has given a new way and a new thinking of prioritizing our health before anything else. And also, the most important aspect which ISW Council is committed to work towards is to empower people or educate people so that they start seeking health. We need to change their behavior into a health seeking behavior, and also to ensure that once they start seeking health, we are able to provide them what they need for staying healthy, to live healthy and happily. So thank you so much, all our wonderful speakers, for joining us. We had a very, very insightful day where we discussed multiple aspects. I am sure the kind of recommendations is coming out of it will be useful for all stakeholders, for many sectors, and including the government, to work and collaborate and converge for better health of this country. I would be requesting my team. We will be placing or presenting a vote of thanks or token of thanks to each one of you in form of not only appreciating your work and your contribution to the health, but also opening or extending our bases and our partnership to each one of you by making you the health and well-being advocate for taking this whole movement, this initiative forward. So thank you so much, Dr. Rajan Sankar, for the wonderful work which you are doing under Tata Trust and bringing a very, very important intervention for the society. Thank you so much for your time today, and we look forward to collaborating further and having you share your insights and your knowledge in our forum in future as well.
Thank you. Thank you very much.
Thank you, sir. Thank you, Dr. A. Lakshmaya, for your time and a very, very critical insights which you shared. We are looking forward to keep taking this message and this discussion forward in all possible manners, so that it kind of encourages many more to work towards improving the nutritional aspect of our country.
Thank you, Dr. Kamal.
Thank you, Dr. Meera Agnihotri. Or however, just to correct, I'm not doctor. So, but I get a opportunity to hear so many doctors to empower and strengthen our discourse. Thank you so much, Dr. Lakshmaya. Dr. Meera Agnihotri, thank you so much for your time and for your wonderful work which you are doing in WWW Foundation for Women Empowerment. We are happy to associate with you in multiple forums, and also for your various initiatives which you are taking up to help women in their health and well-being requirements.
Thank you.
Dr. Bhavna Sharma, thank you so much for your time and your insights, and I'm sure the wonderful work which your organization is doing and the way you are, taking that forward, it is going to definitely help a lot many people to get what is needed most when it comes to the health and nutrition as part of the life. So thank you so much. Thank you, Dr. Ankita Marwa, for your participation and your contribution, your insightful, views. Thank you. We are looking forward to have many more such discussion in the future. And last but not the least, thank you so much, Dr. Bobby John, our co-founder, and also, one of the most passionate, health advocate. Thank you so much. You bring life to the discussions, and you give them a path which is really something which make it very, very kind of easy to understand as well as easy to execute as well, I believe. So thank you so much, Bobby, for the time and for kind of taking this discussion in such a wonderful, lively, and insightful manner. Thank you so much.
Kamal, I'll just add to what
Dr.
you
Baby
said.
John, this is a wonderful moderation, great moderation.
Yeah, so much thought to food. You said, I think for the audience, there is food for thought. You've given so much thought to food and nutrition. So thanks for, passionately having this discussion. It was great to be with all the other panelists. Thanks so much.
Thank you all. इससे ज़्यादा बदहज़मी हो जाएगी. Thank you so much.
No, I think thank you so much, Bobby. I think it was really wonderful. I think the way you navigated, because like we said, we always are saying multi-stakeholder discussions. I think the toughest part of it is to just have a open, transparent, a usable, discussion in a way that we all respect each other, and we focus at that one thing in the end, which is that one family or that one child in the end, so that some good can happen later. So I think thank you so much for navigating it, and I thank you for organizing this.
Thank you, Kamal. So
Thank you so much, sir. So thank you. So for our audience, this was the 6th edition of India Health and Wellness Summit, the flagship program and a multi-stakeholder discussion about creating a healthier nation by fixing the fundamentals of ensuring good air, good food, good water, and good health care for everyone. We look forward to come back to you with a lot of ongoing discussions on health and wellness, and especially during the time of COVID-19, and looking forward to see you all in the next edition of India Health and Wellness Summit, and hopefully with a lot more to celebrate. Thank you so much.
Thank you.